You can do a roll call to establish quorum.
Yeah, that's what I'm going to do. Okay. So let's do roll call to establish a quorum. I'm here. Vice President Mary Fagan.
Mary Fagan here.
Elizabeth Woods.
Woods here.
Imelda Sehebukowitz. Susan.
Here.
Jovita Dominguez.
Here.
And Trisha Nguyen.
Trisha Nguyen here.
Okay, we have a quorum. Do we have Lori on?
Reza as well. So we're ready to begin.
We're ready to go. Okay. So going back to discussion regarding 7.3, we heard some public comment. Do you think we need to open it up to further public comment?
I think there were still a few people in queue.
Yeah. Okay. Yeah, so we can go ahead and see if those same people are in queue and open back up for public comment.
Be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Dr. Dittmer would like to make a comment. 1 second, please.
This is Reza. Can you hear me?
Yes.
This is a continuation, I think, of the previous public comment period. I don't think this is a new opportunity. So I believe Dr. Dittmer had an opportunity to make a public comment on this item and did. Again, this is just for anyone who didn't have an opportunity during the initial comment period that was taken before the lunch break.
Okay. So no, do not. She's the only request.
I mean, I'll defer to the board if you want to allow second chances, but again, that's usually not. Usually, we limit to 2 minutes per agenda item, and this was merely a continuation of earlier.
Of earlier, yes.
Okay. Okay. Sorry, Dr. Dittmer. Board President Trujillo, there are no other requests for comment. Would you
All right,
like to
great.
go this one, though?
Sure, go right ahead. Thank you. Okay. We've heard some public comments. Do we want to make a motion or do we want to have further discussion, board members?
I would like to make a motion that we do not do any naming conventions for the nurse practitioner practicing pursuant to standard procedures.
Sorry, Betty.
Betty, can you speak up?
Not hearing me, right? Is that
No. You sound like you're in the bottom of a barrel, ma'am.
Yeah.
I'm not, but okay. What am I going to do here? I'd like to make a motion that we don't do any naming conventions for the nurse practitioners. Is that enough, or do I have to
Yes.
make it longer than that, or what? Trying to do things as quickly as possible. As possible. I don't want any naming.
I think if that's what you want, then your motion said it all, and it's sufficient as is.
And that's all there is to this. It's about naming, if we're understanding this correctly.
Yes.
I second that motion.
Sorry, who was the second? Was that Mary?
It's Mary. Mhm.
Thank you.
State the motion. I did not hear it.
The motion is not to be naming conventions for nurse practitioners.
Thank you.
In a second? Correct. Okay, we can take it to a vote.
Woods, yes.
Dolores Trujillo, yes. Vice President Mary Fagan,
Mary Fagan, yes.
Imelda Ceja Bukiewicz,
Yes.
Susan Naranjo,
Susan, yes.
Jovita Dominguez,
Yes.
and Tricia Nguyen.
Tricia Nguyen, yes. Thank you.
Okay, motion carries. Moving on to 7.4, discussion and possible action regarding fee analysis to determine value of initial application fee pursuant to BPC section 2837.104. Lori, are you speaking on this one also? All right,
Absolutely.
thank you. Take it away.
Thank you. On 7.4, we thought we would have a possible action, but it's going to be more just a discussion. We do have the fee authority to charge a fee for the 104 additional category. We did speak with a staff of Wood, which is doing the cleanup bill for AB 5852, regarding adding the fee authority for collecting a cost for our staff work for 103. And they were happy to add that to the cleanup bill so that we can get fee authority if that cleanup bill passes AB 852. What we've done so far is do a desk audit. We have a similar process that is done within our advanced practice unit. So we correlated that with what we anticipate would occur with this new process of putting it out onto the Breeze website so that employers or patients or whoever can go in there and see the difference of the NP to do a 103 or a 104 NP and put it back to the statute so they can clearly see what is the expanded scope of practice for that nurse practitioner. I do have Matt Nishimi in, and I hope I'm saying his name correctly, in our attendees. Board moderator, can you elevate him? And he'll kind of discuss the process of what occurs with a desk audit, what occurs with going through and establishing a fee and just talking about that process. And then we hope to, at the next board meeting, be able to come forward with a finalized product to have the board take a vote on. Matt, take it away.
Yes, so we're starting to work with the board to do an internal fee study to, it analyzes the workload inputs to process the certification. It's a one-time certification fee and use that as a model to assess the other two or the other, the NP 103 when it, after it's, after the next bill goes through. So it's going to be very similar. It's basically just a workload model again to show the inputs that go into the actual cost it is for the board to produce that certification. And we're looking at it now. So we don't have numbers for you at this point. Hopefully by the next meeting, we'll have an estimate and you can see the inputs at that time.
And then real quick, Matt, if you could expand on kind of the process that it goes through. That was eye-opening to me and really helpful for me to understand. And because what I was thinking we would do is kind of compare like to like, kind of see, okay, we have $100 for a temporary license, we have $350 for an RN license, that there would be some sort of kind of similarity. And I was wrong, completely wrong. It's a different process. I'm learning a lot through this process. Matt is guiding me, and he has a lot of interesting thought process with this. And really, it's great to kind of know what goes on to that, where they take into consideration the level of staff, the staff wages, the time, and everything. And that's where the fee comes from. So that might be a good thing to kind of share with our stakeholders on how we establish fees.
Yes. So as Lori mentioned, I am in the budget office, but I also manage all of the regulatory packages that go through DCA. And my office, we provide the economic and fiscal impacts to all of those analyses. We also do them for the legislative analyses. So anytime there's a fee related package, it's going to come across my desk and I'm going to know about it. So as far as the inputs for a certification to determine what the certification fee should be assessed, Lori brought up the point of, can you just take another cert and say that those costs are going to be the same? Yes, you can use them as a model, but every program can be different. And every certification or license type can be different, can have a different exam component requirements, different education requirements, etc. And so we're just trying to drill down on what the inputs are for board staff to receive and the file, and to do some administrative cashiering and responding to inquiries if they come up. And clearly there's going to be a lot of questions. This seems to be a very interesting certification process that you guys are undertaking. So I would say that we're going to have to take a fresh look at this and do a deep dive on it and not compare it. We can use the other ones as models, but we want to really figure out what those processes are, and we'll go from there. Again, we don't have anything concrete at this time. And so once we do, we'll certainly get that back to you. Just generally speaking, comparing whether it's a fee or a certification fee or a budget or a program, it can be difficult. I know that it's logical to assume that a board of your size and makeup is very similar to another similar size program. That may or may not be the case. I mean, because it's all about your statutory mandates. It's all about how robust your enforcement is. There's so many factors that go into your spending and your revenues. So again, we don't want to really grab one and use it as a model for use it for all programs. We want to do a deep dive.
Thank you, Matt. I know that when we were discussing this, we were talking about whether or not it would be a renewal fee, whether or not it would handle enforcement costs. And so there's a lot of stuff that goes into this. The thought is there will be no renewal, that the renewal would only be the nurse practitioner license. And that once they receive this, that it would just be on there to show that they have the ability to work in an expanded scope of practice. So that would help to save our licensees by not having to pay an additional renewal fee, as they already do pay for their nurse practitioner furnishing, and their RN license. So the only renewal would not be for the category or the 103 or 104 section. It would just be for the license that they carry already. So it would be a one-time fee, and it would not repeat. And so that was something that we definitely looked at and worked through that. So if you guys have any questions, if you guys have any other information on this, we can take that now. If not, we can, as it is information only, we can open it up to public comment. But it is kind of nice to have Matt here on the line, who can walk us through this process, because we will have to move on a vote pretty soon. In our regulatory language that we developed for the implementation of AB 890, it referenced the section 1417, 16 CCR 1417, that said that we would charge a fee that would be added to that section. So we will be starting a regulatory package on CCR 1417 when we get this fee study completed and move along. But that will be separate to the implementation of AB 890, as we did not want to have a delay in 890 or any conflicting arguments on fee that could potentially delay the implementation of the transition of practice and expanded scope of practice.
And may I add another comment?
Imelda?
Oh, go ahead, Matt. He wants to add another comment. I'll listen.
Oh, no, please, after you.
No, I mean, basically, I was going to ask, I think this is really good. Thank you for explaining that. I've often been asked by nurses, you know, we have this license, we get this license, now we have to renew this, and now we have to renew that. It's all this additional cost. So as we're evaluating that, I would hope that maybe we could reevaluate some of the other costs incurred by the nurses. It seems like they're always paying for something. I know that we need, you know, to ask for a fee because of the processing, but I think down the road, maybe we can kind of reevaluate all the licenses. So a nurse doesn't, you know, she's paying out a lot of money as it is, but they just keep adding and adding and adding more cost to additional certifications. That's just my comment. Thank you.
Go ahead, Matt.
Yes, thank you, Madam President. So as you guys know, or may not know, your fees are established by statute. And then we come in with a regulatory package on top of that. So they're set in regs and in statute. The regulatory process takes 12 to 18 months to fully promulgate a regulation. I would say at this point, we're in the early sort of education stages. We're still figuring out, wading into this. And we'll figure that out over the coming months. And then hopefully by the next board meeting, we'll have the numbers and we'll have a more robust full presentation for you guys. And then you can vote on the language. And then once you vote on that language, it's going to take 12 to 16 months to get through the regulatory process. And so we're going to put the regulatory package together after you board members vote. If in the event you board members vote to approve it, we'll begin putting the package together. That package goes out for public comment. This, I'm sure, is going to have a lot of public comment. And so I would say that and then it has to come back to us, and then it has to go through the remaining regulatory process, back through agency and back through the administration. So it does take a little while. I would say probably 12 to 16 months from the time you guys vote on the language.
So this is a fee for nurse practitioners and for nurse midwives, or just nurse practitioners?
This is a fee just for nurse practitioners. When the bill for AB 890 was written and passed, it had a section under 2837.104 that says the board can charge a fee for the work that has to be done to allow for this to occur. So we are doing the fee analysis to present that fee forward.
So I don't recall, is the nurse midwives also going to be having a fee? Or?
No, so the nurse midwives do not have a fee because they do not have a tiered entry. They do not have separate sections like the nurse practitioner does. Once you're a nurse midwife, you're a nurse midwife, and there is no various expanded scope of practice. It's a one and done. Everybody gets it as long as they're competent. With the way that AB 890 was written, they wrote it where there is a nurse practitioner that has to work under standardized procedures. There's a nurse practitioner that does not work under standardized procedures, but must work within a healthcare facility with other partners of some sort. And then they have the 104 nurse practitioner that can work in an independent practice underneath their national certification after they've completed these various steps. And so it is the nurse practitioner scope of practice is in no way comparable to a nurse midwife scope of practice. The way that AB 890 was written is no way comparable to the way that SB 1237 was written. And due to that, they're completely different implementations. When you heard from Mary Kay Phillips on here, the chair for the Nurse Midwife Committee, she said we didn't have to do any regulations to implement SB 1237. It just happened when the bill passed and it became in effect. With AB 890, the way that they wrote it, they specifically put language in that said the board must establish by regulation this, which then required the board to promulgate regulation and go through that process, therefore delaying the implementation of certain factors that would be available with the passing of AB 890. Additionally, they wrote in the OPES that they have to do their evaluation and they have until January 1, 2023 to give us that report to see whether or not an exam is needed for the transition to practice. So these are two separate bill implementations that were passed and put into statute that we're going through. So they're no way comparable, Betty. I wish they were. I wish it was easier. But AB 890 is not as easy to implement as SB 1237.
Yeah, the nurse practitioner portion is much more complex for whatever reason.
So Lori, does that mean that no one's going to be able to practice at the 104 level until all of this work gets done?
Sorry, it took me a second to get off my mute. I had a document pop up right over top of the mute button. Yes and no. The way that this bill was written says we have to establish a transition of practice by regulation, and the exam was part of the transition of practice. That's a 103 NP. We get that into effect by January 1, 2023, if we can get it through the regulatory process and not have a bunch of opposition and comments and et cetera, which by listening to the public comment, I don't see that that's going to go smoothly or quickly. Each time that there is a public comment period and there are comments, we have to address those. We address those comments, it goes back out for 15 days. We address those comments, it goes back out. And so it could be tied up in the regulatory process indefinitely. It is, as long as stakeholders are making comments and we're answering them and making corrections. Anytime we have those corrections, they go back out for public comment, and you have to do that in order to get regulations passed. So that again is one of the reasons why we held the stakeholder meetings prior to even introducing regulatory language, so that we can show that we're listening, that we're getting this information and we're going through it. Reza also has been working to create a table that puts all of those comments together and then says why we've done what we've done. Because a lot of the asks that people are asking for is not, we don't have the authority to do that by the bill that was written. AB 890, now that it's in statute, doesn't give us a statutory authority to do a lot of the things that they've asked us to do. So we're going through that process. He's making this an amazing document, and we'll be sharing that and kind of speaking about that, I'm assuming, potentially the next board meeting. With that said, the 103 NP, which could essentially, if we have the regulatory language done and it's passed, start on January 1, 2023. That person that applies for that has to work in the 103 capacity for 3 years. So the 104 that this fee is for will not come into effect until 2026. So we have ample time to get regulatory language together for a fee for the 104 NP, which is who we have authority for currently. Because the way that the statute was written in AB 890, when that bill went through, is that they have to work in California for 3 years as a 103 NP before they can move to be a 104 NP. And again, that I'm assuming that is probably why there's a cleanup bill out there for AB 852 that may address those. But until those are addressed, that is the pathway that we have to follow because that's the statutory authority that we have.
Excuse me, this is Reza. And we also have our regulations attorney, Heather Hoganson, on the panel. So if I say something incorrect, I trust Heather will correct me. I just wanted to clarify something about the process that Lori mentioned regarding addressing a public comment. As she said, we have to hold it open for public comment. And once those are received, we respond to them. You can respond by either making changes to the regulatory text or responding to indicate that you considered the comment but didn't make changes for whatever reason. If you've made significant changes to the regulation, then it has to go back out for another waiting period, either I believe 15 or 45 days, depending on the magnitude of the changes, whether they are kind of minor or major changes. If you receive public comment and don't make further changes to the regulatory text, you don't have to go back out for another waiting period for the public comment. So it's not necessarily kind of this potentially endless cycle of public comments and responding to them. There is an endpoint. It just is a matter of whether or not you decide to make changes to the text, and if so, the scope of those changes. So just wanted to clarify that. I think everything else Lori said is correct, though. We can get the 103s going, and under the bill, they need 3 years of experience doing that before they become 104s. So, and we don't currently have authority for fees for the 103s anyways. So I don't see the fee issue being a holdup.
Thank you for that, Reza. That's helpful. I misspoke, and what I was trying to kind of get to is that with the regulatory process, we try our best to answer questions and respond to the public. And we've had several stakeholders in public comment make mentions that they haven't been addressed. And some of that is because we don't have the statutory authority to address. The other things that can happen, though, is it can be held up in OAL. And I can definitely open it up for Heather to speak more on that. It could be held up into OAL, and they could also file suit to stop the regulatory process if they feel that this is in some way a harm or that their concerns were not addressed. So those are things that we're constantly kind of looking at and balancing so that we do hope to get these regulations implemented, but there are possibilities where regs can be stopped. Heather, can you expand on that a little bit more eloquently than I did, please? Heather, I do see that you are elevated to a panelist, but I do not see that you're coming off mute. Are you available?
You may just be taking a second to get whatever it is out of her way so she can unmute.
Do you want to move on and come back to her?
We could. I have reached out to her right now. We did send her some messages real quick to see if we can get her. I think it's really important, and thank you, Mary, for asking the question to really understand, like, what is the implication of this? if we don't vote on this, if we don't pass this, how will it affect the actual practice of the nurse practitioners? And is there a delay being brought on by us? Is there a delay being brought on by the regulatory process? Is there an impact? And so the great thing with the specific question that Mary brought forward was, will this hold up with this ability? I just was reading a message comes through. Heather says that she is here and she's available. She's in the attendees with her hand raised. Maybe she was on double booked. Can you raise up the other person, board moderator, with her hand that is raised? Okay, so as they're working through that, that was a really good question, because with the fee, it's not going to delay anything, because we can get a regulatory package through. We can get all those changed before 2026.
Can you hear me now?
When a 104 is possible. Heather, we heard you?
Can you hear me now?
Yes.
Yes, we can.
Oh, thanks. Okay, sorry about that double speaker problem. So yes, I wanted to confirm that Reza was correct in his explanation. If there were comments that were, completely related, and there were changes that we wanted to make because of those comments or because of other information that came in, we would have a 15-day comment. If it was something that was not originally contemplated in the regulations, but still kind of related, we could go out for a 45-day comment again within the same package. But if there were no changes to the text after the public comment period, then there wouldn't need to be additional comment periods.
Thank you. Can you expand on the process of going forward and potentially having regulations stopped? Like if OAL doesn't accept them, or if there's a suit brought against it to halt?
Sure. So there are instances where an agency can start a regulatory process and decide not to proceed with it and stop that process because of legislation that was changed. So maybe that cleanup bill that you mentioned actually changed some core pieces, and so we said, hey, we need to stop this process and restart it with the new statutory language. That has happened to many agencies many times. Additionally, sometimes an agency will bring a regulatory package forward and some litigation ensues, and a judge could enjoin an agency from proceeding. It's really rare, but it could happen. Usually the regulatory process is finished before the litigation gets to that point. But it's something that could conceivably happen. And then there are always, external factors. Either, Department of Finance has some questions and we say, oh, well, we need to reevaluate, or maybe the governor's office says, there's some things that we need to consider first. Can you stop the process? Because once you start the process, you only have 1 year to complete it. And if you don't, you have to start over anyway. So there are some timing issues that happen. And so sometimes it's just easier to stop the process and restart it again later.
Is there anything that's within our control in the BRN that either we're not doing, that slowing the process, or that we could do that might speed it up?
Well, the slowdowns on board practice in general is that we have to wait for a meeting to get your input on something. And so for instance, today you've made, you had a motion that we're finally coming up with, that we're not going to change those names. And so we can adjust the regulation text now to match that we're not going to have a naming convention that's particularized to the 103 and 104s. So that part was a huge step that needed to happen, and it's now happened. If we do go out for comment and we receive comments, the board has to weigh those as a whole. And so if the comment period ends the week after your board meeting, you've got to wait till the next board meeting. So in terms of, is there anything you could do to speed it up? Yes, you could have special board meetings to just deal with regulatory comments or changes in text that are planned. And boards do that there's a cost, and there's definitely the Open Meeting Act considerations that you can't just do it tomorrow. You know, you got to plan it out. But that is one thing that boards can do to make the process go faster.
Thank you.
Me again. I just wanted to say that notwithstanding all these policy and operational decisions that you guys are going to be making, we need to consider that there's some 30,000 nurse practitioners licensed with the board, nearly. And to the extent these folks apply for these certifications, there's going to be real workload at the board. And so when we come up with a number, there is real workload that's going to be done. And you as board members, as I'm sure they told you in your board member orientation training, that you have the fiduciary responsibility for running this board. In addition to the operational and the policy decisions, you guys really have the fiduciary responsibility of running this board. But as a policy decision, you guys can set the fee at whatever level you want to set the fee. So if that fee is, if you decide to set the fee at a lesser amount than what the workload identifies, you as policymakers have that privilege.
Great, thank you guys. This was all super informative. I really, really appreciate the help from DCA and having both Heather and Matt here to assist us in this process. We have a lot of newer board members that this is kind of their first process through the regulatory process, first time through the regulatory process. And I know that it's really helpful to me as well. So I wanted to share that out. This is information only, again, more just discussion, no possible action, as we do not have a fee study for you guys to review and vote on. So at that point, we can open it up to public comment if you want to, Dolores. Or Betty, I'm sorry. Thank you.
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in the request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comment. Would you like me to close this window?
Yes.
So it looks like
All right.
we've come to the end of item 7. And
Yes, we're at the end of 7.4.
and we can go on then to item 8.0 for the Education and Licensing Committee. Mistaken?
Jovita?
Good afternoon. My name is Jovita Dominguez, and I will have Dr. I am the chair of Education and Licensing Committee, and I will have Dr. Marianne McCarthy start us off with 8.1.
Thank you so much. I had to wait to be elevated. I wasn't there quite yet. Yeah, moderator, you're in trouble. He's telling me sorry. He's so nice. Good afternoon, everyone. Mary Ann McCarthy, Nursing Education Consultant and Liaison to the Education and Licensing Committee. We're going to start with 8.0, which is the report of the Education and Licensing Committee to the board. And 8.1 is discussion and possible action regarding Education and Licensing Committee recommendations on consent agenda items. So 8.8.1 is discussion and possible action regarding the board approval of Education and Licensing Committee recommendation to approve minor curriculum revisions, acknowledge program progress reports, and accept clinical facility approvals. So according to board policy, nursing education consultants can approve minor curriculum revisions that do not significantly alter philosophy, objectives, or content. Approvals must be reported to the Education Licensing Committee and to the board. A list of schools who have submitted minor curriculum revisions, clinical agency or facility approvals, and program progress reports that have been approved by nursing education consultants are in the materials packet with the corresponding tables named. This is a consent agenda item. And Jovita, if you'd like to make a motion?
Yes, I would like to. Could you help me with the motion, Marianne?
Sure.
Thank you.
Sure, no problem. The motion would be to accept and approve the minor curriculum revisions, acknowledge the program progress reports, and accept clinical facility approvals that are in the board materials.
Thank you. Would any, is that Mary?
Trisha Wynn.
Trisha Wynn seconds it. Thank you. Board moderator, would you please take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box. I would like to make a comment. Please remember, you will have 2 minutes to make your comments. I will now give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, I would like to make a comment. Committee Chair Dominguez, there are no public requests for comments. Would you like me to close this window?
Yes, please.
And can I remind board members and staff, when making a motion or seconding a motion, can you state your name, please, and then say I second? Mm-hmm. Thank you.
I do a complete roll call then of the board.
Yes, I would. I, Jovita Dominguez, votes yes. President Dolores Trujillo.
Dolores Trujillo votes yes.
Vice President Mary Fagan. Susan Naranjo.
Susan, yes.
Betty Woods. Imelda Ceja-Pakowitz.
Imelda votes yes.
And Trisha Wynn. Thank you.
Motion passes. Thank you very much.
Yes,
we're going to move to agenda item 8.1.2. This is discussion and possible action regarding board approval of Education and Licensing Committee recommendations to grant. And if you'll look on your screen or in your packet, on the agenda, you'll see there's 4 separate areas with schools listed. So there's continuing approval of pre-licensure programs with schools listed. There's approval of pre-licensure nursing program unit adjustment or other changes. These are substantive changes, but there is no enrollment increase. The next set is initial approval of an advanced practice program, nurse practitioner. And the last one in this section is approval of substantive changes for an approved advanced practice nurse practitioner program. So the board staff have received and reviewed all documentation for the programs listed in 8.1.2. The information on these requests is included on the lists that are in your packets. And these programs have met all board rules and regulations related to these requests and are considered consent agenda items.
I would like to make a motion that we approve 8.1.2 as stated on the agenda. Do I have a second?
Tricia Wayne seconds.
Okay, thank you. BRN moderator, would you take us to public comment?
Public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. And I would like to take it to a vote. I, Jovita Dominguez, votes yes. President Trujillo?
Votes yes.
Vice President Mary Fagan?
Mary Fagan, yes.
Imelda Ceja Pakowitz?
Elda Seha Budkowitz, yes.
Betty Woods?
Woods, yes.
Susan Naranjo? Tricia Wynn?
Sorry, Wynn, yes.
Thank you. Motion carries. Thank you. Mary Ann, next one, please.
Thank you. Agenda item 8.2, discussion and possible action regarding Education and Licensing Committee recommendations to accept agenda items. And these are agenda items 8.2.1, 8.2.2, and 8.2.3, which you'll see right here on the screen. The Education and Licensing Committee at its January 2022 meeting heard presentations on all of these 3 listed. The committee recommended acceptance of all these agenda items. The agenda item summaries and program reports are included in your materials, and these are consent agenda items.
I would like to make a motion to accept 8.2.1, 8.2.2, and 8.2.3 as it is stated on the agenda. Do I have a second?
Woods will second.
Woods, thank you, Betty Woods. BRN moderator, would you take us to public comment?
Public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, I would like to make a comment. Dr. Carol DeLilly would like to make a comment. 1 second, please. Go ahead.
Hello, and on behalf of Compton College's ADN program, our president, our faculty, and students, we'd like to thank the ELC and our NEC for their support. Thank you.
Thank you. Committee Chair Dominguez, there are no other public requests for comment. Would you like me to close this window?
Yes, please. Thank you. And I, Jovita Dominguez, votes yes. President Trujillo?
Yes.
Vice President Mary Fagan?
Mary Fagan, yes.
Imelda Ceja Bakowitz?
Votes yes.
Betty Woods?
Woods, yes.
Susan Aranjo? And Tricia Nguyen.
Nguyen, yes.
Motion carries. Thank you. Mary Ann, please.
To item 8.3, discussion and possible action regarding continuing approval or other action for approved pre-licensure nursing programs. We're going to start with 8.3.1. This is Los Angeles Trade Tech Associate Degree Nursing Program. And just to clarify, 8.3 and 8.4, these have gone through the committee. However, 3 of them were, the committee decided to move to the board for final decision. And one of them, and I'll tell you as we go through, was moved because there have been some changes since the ELC meeting. Okay, so I'm going to start with Los Angeles Trade Tech. They had a regularly scheduled continuing approval visit that took place in November of 2021. Their enrollment pattern is 40 students twice a year for an annual enrollment of 80 students. Their current enrollment at the time of the visit was 143 students. Their pass rates have remained above 75%. However, in looking at their 5-year list, which is in your materials, you'll see that they have dropped a little bit in the past 2 years. During the visit, they were found to be in noncompliance with 3 BRN regulations. The first one had to do with total program evaluation. The second one had to do with sufficient funds. They didn't have sufficient faculty and staff support. And mostly this was due to just either retirements or nurse faculty leaving their positions over time that hadn't been replaced yet. And the last one was that the director didn't have enough time to dedicate to the administration of the program. So the program's response and all the documents about the visit and the non-compliances are in your materials. At the Education and Licensing Committee, there was a request for them to submit an EDPP 11, and for that, for as far as that form goes, that is kind of a snapshot of a semester. It has the lead faculty, the clinic, or the lead faculty, theory faculty, clinical faculty, how many students, where they're going. So it kind of shows in a more clear way how the where their vacancies are. And there was a hiring update also that I added to that. So they are working on moving towards filling these positions and coming into compliance. I am their NEC and will be working with them as they continue to move forward. And their director, Paula Moorfield, and the college administration are available should you have further questions.
So at this time, then maybe would you suggest that we put this on for the next meeting, or how would we move forward?
Well, it moved from ELC to here.
Okay. So
Mary Ann, can you share what the ELC recommendation was in full? And that was for progress notes, et cetera, because she may just want to adopt that motion.
Thank
Right,
you.
right. So there was discussion at the Education Licensing Committee about deferring action, which means that they don't, I mean, they're not going to lose approval, but they're not right now getting continuing approval. They're just in standstill. So it's deferred approval with quarterly progress reports to the NEC, and then to return in a year to see how things are doing. That's what we talked about. Does that help, Lori?
It does. I'll just clarify. It was deferred action versus deferred approval. So what?
Sorry, deferred action.
That's okay. I just know that I'll get emails after that if I don't clear that one up.
So the motion would be to defer
Defer action, quarterly progress reports to the NEC, and return to ELC and board in 1 year.
Thank you.
There was one other thing to take into consideration, Jovita. I believe it was Dr. Mary Fagan wanted to know about the hiring process, the hiring update, and really how short they were, which is why we added the form, the EDPP 11, and that's the one that Mary Ann was discussing. So I'm not sure if Mary had any questions on that or anything around that. I know there was discussion with the school on getting priority hiring and such. And I know that that was addressed in the report too. So just wanted to make sure that was done before you move to a motion so that we do have an understanding of everybody involved, because I know that that was specifically asked for by, I believe, Dr. Fagan. So
yeah,
just wanted to
Mary, what page is it on? I'm scrolling through materials and I'm not finding the page where they've provided the additional information.
Mary Ann, do you have that information on the top of your head?
I have too many other things in front of me. If you guys could look, I'm trying to present. I don't have the entire packet.
Okay.
Sorry.
It's just
no, it's totally fine.
Were you able to find it?
I am looking at it right now. I know it starts with agenda item 8.3.1, which starts on page 50. That is the agenda item summary. And immediately following that, page 52 is the EDPP 11. That page is 52 and 53. You'll see on the left-hand side the individual nursing course numbers. What contents are covered in that, and that'd be, if you look at RN 170A, that's Med Surg and Jerry. It does show you that the lecture or the theory component is 1 unit. The laboratory or the clinical component is 2 units. It does show that there's a lead instructor, Cynthia Ashby. She's a theory instructor. She has 40 students. And then it shows that the clinical lab instructors are Cynthia Ashby as well. She is also the theory component. She has 2 clinical groups. Vanessa Kibe, C-I-B-E, has a clinical group, and there's a vacancy. So they're missing 1 person to teach a clinical group. There is 10 students each. And so if you have 40 students, we have 30 students covered, and there are 10 students without a clinical, without clinical instructor coverage. Their clinical site is Beverly Hospital, California Hospital. Then you can go down to RN 170. It covers Med Surg and Jerry, 1 unit lecture, 2 unit labs. Cynthia Ashby is also the theory teacher with that one, carrying 2 clinicals up above. She is also carrying a clinical for this one as well with 10 students. Trina Speech has 10 students. Blasius Agum has 10 students. Kathy Vo has 10 students. These are both being covered at Beverly Hospital and California Hospital. RN 171, and you can see that it goes on and on like this to show the coverage, and the highlighted is the kind of one-offs, and that's where there are 2 groups or a vacancy. But really just looking at that shows even RN 180, Cynthia Ashby is a theory instructor for that. She's the theory instructor for RN 170A, RN 170B. She teaches 2 clinicals in RN 170A. She teaches a clinical in RN 170B, and she teaches another clinical in RN 180. And so if you're looking for an overload assignment that is a clear process of showing that. And I know, Jovita, you understand completely as being part of education and faculty. This person is carrying a 3 theory load, as well as covering 4 clinical rotations all during the same semester. So that is important to note, and that's why we ask for these forms, so you can see that yes, they are covering, yes, they are managing, yes, they are doing what needs to be done, and the students are not showing an effect. They're passing, their Nclex are passing, their pass rates are staying up. But the question that Dr. Mary McCarthy brought forward last ELC meeting was the sustainability of this. How long can this continue? And so that's really where that conversation comes from. So I wanted to make sure that we opened that up for conversation and had that kind of understanding on what these forms do for us when they allow us to look at this and have conversations about this when making decisions.
Yes, and this is Mary Ann McCarthy. If you can look at the very next form, after that, you'll also see their update. They sent me an update as far as their hiring process and what was included in that, and you can see their steps. I think it was last week I approved new faculty, and I'm going to have to ask Paula if that's for this semester or the fall. But it was new, it was adjunct faculty to help out. So I am thinking that it's for this semester to help them move forward, but I will let the program director speak to that. Paula, are you available?
Can you escalate her board moderator, Paula Moorfield?
Yeah. I can't hear you, Paula. You're way, way, way far away.
Can you hear me?
You sound like you're in another state. Go ahead, give it a try. I'm going to turn it up. We'll see. Anybody can hear you.
Did hire for this semester, so we do have coverage for those vacancies that were shown on the EDP 11. So they we have hired to fill that
for those. So what she said, just in case you couldn't hear, is that the ones that I just did were for this semester, adjunct faculty, to help cover those vacancies that you are seeing on the EDPP 11.
Yes, and we are in the process of 2 full-time faculty for the fall.
Okay, good. If you guys can hear her, they're in the process of hiring 2 full-time faculty for the fall.
And that's what was outlined in their letter to you, right?
Yes.
Yeah. Okay.
So again, they are working on, filling those needs, which again, the biggest need that they had was in personnel. It's just a difficult thing to do, to fill nursing positions. So they are doing 2, and I think, I don't know if it says in this or not, but they're looking at asking for a 3rd one for next year in the process. So they are moving forward in trying to meet that non-compliance with the additional faculty that they're going to have. That's going to free up Paula, who's the program director, so that she can work on the total program evaluation with the team. And again, when they get a little bit of relief from or a lot of relief actually from the overload, they'll be able to do more in terms of total program evaluation, looking at those things that they need to look at and update, and keep a pulse on, so that the program stays at a solid level. Thank you.
So moving forward, should I restate the motion or?
Sure, why don't we?
Yes. So the motion would be to have 8.3.1 defer action. And also, please remind me.
Sure. Defer action, quarterly progress reports to NEC, and return to the ELC and board in 1 year.
Yes, thank you. Who would like to second that?
This is Mary Fagan. I'll second.
Thank you, Mary. I appreciate it. BRN moderator, would you take us to public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in the request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Harry Willard would like to make a comment. 1 second, please.
And I'm the Dean of Nursing at LATTC. And I would just like to say how much we are working to fill these positions. We have 2 new full-time positions that we will be advertising for imminently. And we have just hired 4 brand new adjunct faculty to do clinicals. And we've also pulled in an adjunct faculty from one of the other institutions in our district. And we are continuing to look for additional new adjuncts to help us in the fall. But we have really gone above and beyond. Paula Moorfield, especially our director, has really gone above and beyond to find as many new faculty as possible. So thank you for your consideration of that hard work.
Thank you. Committee Chair Dominguez, there are no other public requests for comment. Would you like me to close this window?
Yes, please. Thank you. And I'd like to take it to a vote. I, Jovita Dominguez, votes yes. President Trujillo?
President Trujillo votes yes.
Vice President Fagan? Susan Aranjo?
Susan, yes.
Betty Woods?
Woods, yes.
Imelda Ceja Bakowitz?
Yes.
And Tricia Nguyen?
Nguyen, yes.
Thank you. Marianne, would you take us to the next one, please?
Yes, of course. Thank you. 8.3.
Oh, I'm sorry. I think I should have said motion carries. Sorry about that.
Perfect. 8.3.2, discussion and possible action regarding continuing approval or other action for an approved pre-licensure nursing program. This is for Victor Valley College Associate Degree Nursing Program. And board moderator, if you could have those people on the list for Victor Valley available and moved up just in case there's any questions. So Victor Valley also, in the same vein, had a regularly scheduled continuing approval visit in November of 21. And at that time, there were 16 areas of noncompliance. These noncompliances were in the following areas: military, LVN, previous credit, curriculum, administration and organization of the program, resources, faculty responsibilities, and student participation. As of the Education and Licensing Committee meeting, the program had rectified 7 of the 16 areas of noncompliance and are now in compliance with all regulations related to military, LVN, and previous credit. And they now have completed 3 of the 5 noncompliances related to curriculum. The administration, resources, responsibilities of faculty, and student participation, as well as the other 2 curriculum are still in progress. Donna Shipp is the nursing education consultant, and she and the program director and college administration are available should you have any questions. This is another program where, when it was discussed in ELC, there was a similar discussion about the fact that this would possibly be a deferred action with quarterly reports to the ELC, to the NEC, and then return in a year to ELC and board.
Does any of the board have any questions?
Can you review again, which are the areas in which they remain non-compliant?
They are, so on that bulletin, on that list, they have complete, you want to know non-compliant. Okay, I'm going with non-compliant only. There are 2 areas under the curriculum. If you need to know specifically what areas they are, I can refer to the NEC. Administration and organization of the nursing program, resources, faculty responsibilities, and student participation. Does it help, Mary, or do you want to know the specific 2 that are a curriculum that are still out?
And it sounds like it's more, you said that there were 2, but when you listed them, it sounded more like there were 4 things, including administration and, right? Or
okay, so the first one that I had was military, LVN, and previous credit. They have cleared all of those.
Yeah.
And then curriculum, there was 5, but they have 3 corrected so far, so there's 2 left.
Okay.
Administration and organization of the nursing program is under 1 heading of noncompliance. Resources is under another heading of noncompliance. Faculty responsibilities is another area, general area of noncompliance, and student participation.
So so have any of those been resolved?
No.
Okay, all right.
So again, resolved has been military, LVN, and previous credit, and 3 of the 5 curriculum. So there's still 2 left under curriculum that they're working on.
And the others.
What would be, this is Dolores, what would be classified under student participation?
Under regulation, students are required to be in participation as far as their education and input into, we look for things like input into curriculum, any kind of changes, how they do a lot of, they usually do a lot of surveys or evaluations with them, and how is the program using that input from the students to make any needed changes.
Thank you.
I think I would make a motion that we defer action similar to we did with Los Angeles Trade Tech and with quarterly reports, and then return to the Education Licensing Committee in a year.
I agree. Does the school want to speak to that they feel like they can manage these
If you have questions, Jovita, of course they'll answer the questions, but I can tell you that every program is committed to getting back in compliance. I mean that's why they're here.
Thank you, Marianne.
Yeah,
okay.
They're committed to coming into compliance. So Mary Fagan, can we take that as a
motion?
As a motion to defer action with quarterly progress reports to the NEC and return to the ELC and board in 1 year?
Yes.
And Jovita is going to second that?
Yes, I am. Thank you. Jovita seconds. BRN moderator, would you take us to public comment, please?
Public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. I'd like to take it to a vote. I, Jovita Dominguez, votes yes. President Trujillo?
Votes yes.
Vice President Fagan?
Mary Fagan, yes.
Imelda Ceja Pakowitz?
Yes.
Betty Woods?
Woods, yes.
Susan Naranjo? And Tricia Nguyen?
Win, yes.
Thank you. Motion carries. Marianne, the next, please.
Moving on to agenda item 8.4, discussion and possible action regarding approval of an initial self-study for a new pre-licensure nursing program. So these two schools have already gone through the feasibility process, and we talked about that a little bit at the last meeting. If you need more clarification, please ask, but they go through a significant feasibility study in order to get to the self-study phase. Once they are approved by the board at the feasibility stage, they go forward with the self-study, and this is the NEC. We do the whole workup to make sure that they meet all regulations before bringing them to you for their initial self-study. After their initial self-study, they are prepared to start enrolling students and begin the process. So 8.4.1 is Fresno Pacific University Baccalaureate Degree Program. They are a new program, and I just want to clarify that they were a consent agenda item at the ELC. However, this is the program that has some changes, and to be transparent and to be and to assist them, we decided to bring them forward as a present item for this meeting. So since the committee meeting in January of 22, there were 3 concerns that surfaced. And so I really want to update you to make sure that you know and show their plan, because they do now have a plan in place regarding these concerns. The first concern was that the program director at the time was scheduled to retire, and there wasn't an immediate succession plan, which made some people uneasy. So since then, they now have hired an interim program director that is in place, and they plan to recruit an experienced program director in the next 6 months. The person who they have chosen is very experienced and will easily be able to lead the program. The second concern was regarding content experts. Because they're planning to start in August, the end of August, I think it's like the 29th of 2022, they are still missing a couple key faculty. They're OB faculty and they're psych mental health faculty. These positions are posted, and they plan to have them filled as soon as possible. In the meantime, the interim program director, where I'm going to work with her to figure out if we need to do any other things to cover these 2 areas until then. The third one was in regards to space and supplies. There was some concern that maybe the actual facilities or supplies wouldn't be ready for the fall of 22. So the program has addressed these concerns. And this happened after materials were submitted. So I did have an extra thing posted that they submitted that went through each of these things and what they have done. So I'm hoping you can see that. If anybody can help me with what page that's on in the materials, that would be fabulous. I did meet with the new program director and the dean on 2/15, and we discussed their progress, where they're at in their progress. I have told them that I would probably request progress reports, as well as a visit prior to the August 29th start date, so that we could actually see those resources, meaning facility and supplies and stuff on site. Their first semester does not include any clinical, so it would just be in-house. And right now we're doing that virtually, but depending on what happens, we might even be able to go in person. So again, they're requesting a new pre-licensure nursing program, and they've completed their initial self-study. Their enrollment pattern is for 24 students once a year, starting in 22. Then they want to go to 36 students once a year in 23, and 48 students once a year starting in 24. And then they want to stay, 24. And then they want to stay at 48 students moving forward.
Arthi, your question about the page number for
Yes, thank you.
Fresno Pacific University, it is not in the general meeting packet for 8.0. It is listed below where it says on the meetings page on our website. It says Fresno Pacific University update. So it is
Excellent.
a separate upload and you can view that. That was added additionally.
Perfect. Perfect. And it's actually listed on there, Fresno Pacific University update. I do see that now. Thank you so much. So this is where they have addressed all those things that that I referenced to. The final thing is that we always talk about, workforce data, and the regional data for the Central Valley and San Joaquin region faces shortages, as we've talked about, as much as 20 to 35% or more. The workforce supply and demand for registered nursing in the San Joaquin Valley forecast is that the supply for RNs will decrease. At the same time, the demand for RNs is expected to grow because of population growth. Imelda, could you put yourself on mute, please?
Sorry.
Program data agrees with BRN data, and I'm covering this program today. The NEC is off today, and the program director and college administration is here to answer any questions should you have any.
This is Betty. I'd like to know the cost of this program, please.
I believe it's on the AIS, which I don't have in front of me. But if
See it on
if Tara Savant is available, she is the dean of the program. If you could elevate her, I'm sure she could answer that question.
Servant from Fresno Pacific University. Thank you so much for considering our program. Our traditional undergraduate fees for the entire program. I'm trying to get that information before you. I think that the annual cost for an average undergraduate institution is approximately $45,000 per year. Our students, however, receive approximately a 62% discount rate. So if we apply the discount rate on average for the students as they're eligible for financial aid, their cost is reduced significantly to approximately $27,000 per year. And some students get significantly more than 62%, but that is our average discount rate at Fresno Pacific University.
So that includes the general ed portion and also the RN portion?
Correct. So the program is suggested to be, or is planned for 4 years. The first 2 years are our pre-licensing requirements, pre-licensure requirements, prerequisites for the program, as well as the general education. So the costs of nursing courses versus general education are the same. Students pay a blank, or I shouldn't say a blank, they pay a standard fee per semester as an traditional undergraduate student. And that's approximately, again, $15,000 per semester, which totals approximately $45,000 if you include room and board. But there is typically a discount rate of 62%. So that brings the effective cost on an annualized basis for a traditional undergraduate to approximately $27,000 a year.
Including room and board?
Yes, ma'am. And that's because the majority of our students the majority of our students receive a significant amount of federal aid in the terms of Pell Grants, as well as state aid in Cal Grants.
Thank you.
Yes, ma'am.
And I do apologize, Betty. We try to have that on there and it clearly slipped right past me. So I apologize. Thank you for that question, and we'll continue to do our best to have that on.
So Marianne, you said as part of the normal process that you will be going back to visit again before the program starts in the fall? Oh, it looks like you might have just lost your connection.
Gain connection or come back on. It looks like she's got just low bandwidth. So with that, yes, the typical process is if there's anything that needs to be reviewed prior to students occupying, such as a physical location, the BRNs, NECs do a review on that to see that students can come in. If they find areas of issue, they bring it back to the board. An example of this happening was when GCC took over Brightwood College that closed abruptly. GCC took them over. They had a campus located right down the street. Prior to the students being able to occupy that, the NEC showed up, did a review. They allowed students to start, but what they did is brought it back to the board to say the Wi-Fi wasn't quite yet there, the cubicles for the offices weren't quite made, et cetera. So the board was kept aware of every single process along the way. That happened kind of in a urgent situation, so the board allowed for students to occupy that space because it was a closed campus that they were absorbing. With this process, because it is a new program and it's gone through feasibility and it's at the self-study phase, the NECs do a review to make sure that they're in compliance with all boards in all rules and regulations. One of those regulations is resources. Resources include having adequate facilities to support the students. So with there being concern about whether or not there are equipment that is able to be there and available for them, whether or not there's space available for them, the NEC that's assigned to this program can do a review prior to students occupying. They did, the campus, I met with them as well. The campus did speak with the assigned NEC, the supervising NEC, Dr. Marianne McCarthy, and myself, and assured us that they were working on this and that they will have the resources available for the August start. The thing to take into consideration here is the students are already enrolled and they're enrolled in the pre-nursing courses. So that was a little bit different than what typically occurs. What typically occurs is when you're approving a nursing program, you do not enroll students until that program is approved. This program is not approved yet, but they do offer the pre-nursing courses outside of this nursing program. So the students have been enrolled into that and they're waiting to go into their nursing courses, which will be available for them, and they should have the resources to support that through with us being able to validate that through a meeting. And I was just informed that Dr. Marianne McCarthy is back on and she is available to speak if needed.
Well, I think based on what you said, Lori, that I'd like to go ahead and make a motion that we approve the initial self-study for the Fresno State program.
I'll second you. This
Is
is
that-
Dolores. I'll
Dolores?
second you, Mary.
Thank you, Dolores.
Can you do me a favor and in that motion state the annual enrollment and when they're supposed to start? The request, I believe, is there's an enrollment pattern on page 143 in our materials, if that's helpful for you, because that does go into our board action letters, because this is approving a brand new nursing program. So this is their certificate of approval.
24 students for the first year.
Mm-hmm.
You have to do the subsequent years as well.
You can do 24 students each year and leave it at that. You can include the increase as requested if that is how the board chooses to vote. That is completely up to you. If you do not approve it and you do the 24 students annually, then they would have to come back as an enrollment increase, a substantial change request to do any enrollment increase up to 36 or 48, or you can approve it at 48 students annual enrollment, and then they can do their teach in like they've designated, and then you would know that they have a 38 annual enrollment, and they can always enroll less than that. They just can't enroll more than that.
And Lori, can you hear me?
Yes, I can.
Okay, good. Sorry, I lost all power. I just wanted to say too, and I missed some. So if this is already in there, let me know. Did we want to do any progress reports for this program? If so, I would like that to be in the motion as well.
So that's what I was trying to understand was so you're still going to be going out there, or the NEC is still going to be going out there to review the program. That does not include a progress report?
Well, we typically would have already gone. So this was Jeanette Wackerly's school, and she had already gone to visit them. I am going back out, or the NEC is going back out, because of the concerns that were brought up about facilities and supplies on campus. So no, automatically they don't have to do progress reports, and we don't have to do them. When I talked to them this week, I told them that I would probably be requesting, which I am, progress reports quarterly, because they are a brand new program. We don't typically, once they're approved, they go. If there's no problems, we only bring them forward if there's problems. But because they're still rectifying these 3 things, they haven't hired the faculty yet for those positions. They have an interim program director, but not, they don't have a permanent person. And because of the supplies is why I was thinking that we would want them to update us at least quarterly.
Okay, I'll amend my motion then to propose that we approve the initial self-study for the new pre-licensure program. I would suggest just for the initial 24 students in the first year, with quarterly progress reports, and then returning to the ELC in 1 year, where they could request an increase in students if things are going well.
Correct.
Another question here. On page 183, it talks about LVNs, section 7 LVN 30 unit option. Could you please explain that a little bit more? Is this 30 units just in RN classes?
Betty, the 30 unit option is in legislation that every pre-licensure nursing program has to offer. That's the one that they don't get a degree. They can just go through and take coursework to meet the requirements of licensure. With that, they're able to sit for the Nclex and pass the Nclex, but they do not have any kind of degree. It is often even though it's in legislation, everybody has to have it. Well, they haven't started yet, so they won't have any records of what they have, but many programs have not had anybody go through this process in quite some time.
So you may be able to get your RN, but you wouldn't be getting an AA or a BSN.
Correct.
Thank you for that explanation.
Sure.
Yeah, and just to kind of jump in on Dr. Mary Fagan's response, this is Lori. Every pre-licensure nursing programs has to have a total curriculum for approval that meets the requirements in CCR 1426 for education preparation. Part of that is they can enroll students in an advanced placement. So once they have the entire program mapped out and curriculum approved, they can enroll a student into any area of that program that they want after they've done an evaluation. They can do transfer credit, CLEP credit, experiential credit, all of that can occur. And a student can take as little credits as they need at this one location. We do find that occur commonly with our internationally prepared applicants, where they'll be short on an OB class, and they will come and enroll in one of our approved pre-licensure nursing programs, and they will take just that OB class with clinical, get that completed, and they can meet our licensure requirements. Another one that comes into understanding here is that 30-unit option. So there is a statutory requirement that was put into our Nursing Practice Act years ago that requires every school to offer a 30-unit option. And that means 30 semester units to get licensing, to meet the licensing qualifications in California. That is a non-degree RN. And that person has a very difficult time transferring their license out of California. It's not typically recognized by other boards of nursing. And so in the regulation that has been promulgated to support that business and professions code, there is statements in there that the nursing program director must provide counseling for any person that chooses this option, so that they understand that they are a non-degree grad, that they only meet the licensing requirements in California, and that most states will not allow them to work there because they do not have a degree. And they've only just met California's licensing requirements.
Thank you.
You're welcome. Thank you.
So now that we have a motion and a second, I would like the BRN moderator to take us to public comment.
And while he's doing that, can you tell me who seconded, Jovita?
I believe it was Dolores Trujillo.
Thank you. Thank you very much.
Mm-hmm.
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. I'd like to take a vote. I, Jovita Dominguez, votes yes. President Trujillo?
President Trujillo votes yes.
Vice President Fagan? Imelda Bekowitz?
Imelda Bekowitz, yes.
Betty Woods? Susan Naranjo?
Susan, yes.
And Tricia Nguyen. Motion carries. Thank you. Next, please.
Yes, agenda item 8.4.2, discussion and possible action regarding approval of an initial self-study for a new pre-licensure program for Shirshai Krish Institute Associate Degree Nursing Program. So the same as Fresno Pacific, they have requesting a new pre-licensure program, and they've completed their initial self-study. SSKI feasibility study was accepted by the board on February 1st, 2021, with an enrollment pattern of 24 students 3 times a year. The Institute is now requesting an enrollment pattern of 30 students 3 times a year. And I wanted to also note that at the Education and Licensing Committee, one of the members had requested student financial resources list to be submitted, and that is in the materials packet. It should be right under, or just following the stuff for Fresno Pacific. And so they have submitted that, and that's available per the packet. The Education and Licensing Committee did talk about approval with the enrollment pattern that was approved in the feasibility study back in February of 2021, which was 24 students 3 times a year for the initial self-study. As far as the data goes, the Los Angeles region of California has a growing supply of registered nurses due to expansion of local RN education programs and satellite campuses. Projections of supply and demand through 2035 indicate that an RN shortage may exist now, but is likely to rapidly dissipate due to rapid supply growth. The program's data does vary from the data reviewed by the BRN because it does not show the same workforce need, which is what I just read is what we found. Donna Schutte is the nursing education consultant, the program director, and college administration, and their consultant are available should you have any questions. And BRN moderator, if you could move them to panelists just in case there's any questions.
Does the board have any questions?
One of my biggest concerns about this program continues to be that looks like it's $70,000 for a 2-year ADN program, which just seems astronomical.
Yeah, I hear you, Mary. However, that was all in the feasibility study, which was approved in February of 21. So we're kind of past that. Sorry.
I know, I must have missed that at that point.
So
if the board wish to make a motion, and if in the motion, please state the corrected enrollment number that you want to approve. Again, this is a new program approval, so we need all of that information as this is a certificate for opening a brand new nursing program.
So this is Jovita. I would like for 8.4.2 to have the initial enrollment, I believe, was 24. And can you help me, Marianne, with
Sure, of course. So I believe the motion, if you want to do the 24, it would be approval of an initial self-study for a new pre-licensure nursing program, SSKI, with an enrollment of 24 students annually.
And they could come back and
Yes, it's always an option to come back and do a substantive change with an enrollment increase.
Yes, thank you. And then I believe, would we also want to have them give progress reports? Or
I don't think that would be necessary at this time.
Thank you.
Oh, sorry, I made a mistake. So sorry. Thank you for correcting me. Somebody's helping me. I think the enrollment pattern, and I need to look at it again because I don't want to get it wrong. Okay. Yes, I said it wrong, so let me do it again. Yes, for the approval of an initial self-study of a new pre-licensure nursing program for 24 students 3 times a year. And then they can always come back. So because they're the ones who had it progressing from, that was, yes, 24 students 3 times a year. They were asking for 30, but they had originally posed 24 students 3 times a year. Thank you, Donna Schutte, their NEC, for jumping in there. So again, it would be approval of this new program, 24 students 3 times a year. And then I don't think we need to put in there about coming back because any program is capable of coming back and asking for a substantive change.
Thank you. Would anybody like to second the motion?
So real quick, let's extend that motion to 24 students 3 times a year with an annual enrollment number of 72 students.
Okay.
Thank you.
Jovita, I will second your motion. This is Dolores.
Thank you, Dolores. Then I would like the BRN moderator to take us to public comment, please.
Public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Amy Talk would like to make a comment. 1 second, please. Go ahead, Amy. Amy, go ahead. Sorry, we'll try to go back to Amy. Barbara Miotti would like to make a comment. 1 second, please.
I am Dr. Barbara Miotti. I'm actually the Assistant Director at Golden West College, as well as a full-time tenured faculty member. I've been teaching over at Golden West College for the past 16 years in the theory, lab, and clinical portions of the program. As a clinical faculty member, I have seen changes over the last 5 to 10 years that are disturbing to me. More often when I bring students to the clinical setting, I find students from other schools present on the unit. This causes me to stop my instruction with students, interfering with their education as I try to find the best learning opportunities present. This is a stressor not only for myself and my students, but also for the nurses and staff on the units. As an example, this past weekend, one of our new part-time faculties called me asking for help because as an addition to her own 10 students, there were an additional 20 students from another program present in the facility, and she did not know how to handle that situation. Additionally, Golden West College is a community college with the increasing number of private colleges, which has opened over my 16 years. I have grave concerns with the ability of individuals in underserved areas to become nurses. They do not have the 70 to 100,000 plus money to become a nurse, let alone to go on and obtain their master's degree. This is why I'm passionate and continue to work in the community college settings. The profession of nursing needs to increase its diversity to improve patient outcomes, and limiting access due to decreased clinical site availability would be detrimental. The proposed new program is within 4 to 5 miles of our campus. I do not think it is appropriate for another school to open and bring more students into facilities that are overly saturated at this time. Thank you.
Thank you. We'll try Amy again. 1 second, please. Amy, go ahead. Sorry, Amy. Alice Montenegra would like to make a comment. 1 second, please.
Agara. I'm the Associate Dean at Golden West College Nursing Program. As one of my faculty have testified, it's been a challenge for our clinical faculty right now to be able to work with students during their historical clinical placements. Right now, one nurse would have to share themselves with 3 other schools or 3 other students. Now, we understand about the shortage, but at the same time, can we really look at ourselves bringing into our region more students, more schools that would gravely impact the livelihood of a nurse at the front line, being able to work with our students, not just students from Golden West College, but really students from other schools as well that's already existing, and be able to give them the experiences that they need? Or are we just pushing students through nursing school and really graduate practitioners who may not be ready? And for that, I would challenge the clinical facilities as to why your residency program had to double the timeline of new grad residency programs. Because the students are being pushed through schools without the actual clinical training because the frontline nurses are very exhausted. Our frontline nurses, have expressed grave concerns of this, and I would encourage the board to look at this as we're trying to keep a balance of what is the right thing to do to develop new nurses into the region without impeding on the frontline nurses who are already working and our clinical instructors who are already stretched as it is. Thank you for listening, and I would ask the board to consider the numbers that you're bringing into the Orange County region.
Question?
Sure.
Thank you. Thank you so much for this public comment. I think it raises a lot of issues, and
yourself. I'm sorry.
Tricia Wen, board member.
Thank you.
I think that this is really an important topic for us to discuss. I was a little concerned about it. We discussed it at length during the committee meeting on this. To hear it again, we're talking about 72 new students who all need clinical rotations. And I'm wondering maybe if Dr. McCarthy can talk us through this about, do these private college students get better placements or better priority, or is it a level playing field? I'd love to hear a little bit more about that. Thank you.
Well, first I want to let you guys know that the program would like to speak, and so I'm hoping that they can be elevated so they can speak. And then I'm not sure. I think I'm going to defer to Lori, Tricia, as far as how we're going to answer that.
Thank you. I'm fine with whoever feels comfortable addressing that.
Thank you, Tricia. This is a long-standing debate that has been going on for many, many years with our board, and leads to why we had a California state audit of our pre-licensure nursing program approval and our ability to approve or not approve enrollment increases. It also comes into our regulatory and statutory oversight. So our statutory oversight comes into public protection. Part of that public protection is the protection of our students who contract with the institution of higher education to receive an education. Part of that education by our regulation is required to be within clinical, direct patient care clinical experiences. Those clinical experiences outlined in 16 CCR 1426 require clinical experience to be in med-surg, OB, peds, psych, mental health, and geriatrics. That requirement of those units that the school chooses, the school can choose to do it with 2 units, 4 units, it's completely up to the school. 50% of that is what's happening right now in direct patient care because of the enactment of the emergency statute 2186.3, or I believe off the top of my head, sorry. And traditionally it's 75%. So part of 1427 for clinical sites says that if you're getting a new clinical site, you must take into account the effect that you have on other nursing schools. What we saw with COVID is that schools were being displaced across the board clinically. It did not favorite private schools. It didn't favorite community colleges. The healthcare facilities closed their doors. As I'm sure you understand, the Board of Registered Nursing has no jurisdiction over any of the healthcare facilities. They can accept students at will. They can decrease clinical sites, clinical groups. So what was typically done was 1 faculty to 10 students, and you saw that on the EDPP 11 earlier. Those now have considerably reduced to about 1 faculty to 5 students. So needing to rotate 2 clinical groups instead of 1, which requires more faculty and takes more time at the healthcare facility. The comment that was brought up by one of the public comments was the effect that it has on the nurses that are at the bedside working. It does take additional time for them to work with it. A lot of the nurses that we hear from, they actually complain about the faculty not being present on the unit and not overseeing their nursing students. And that does sometimes happen. And that is because they have to shrink the clinical number of students on the unit. So a lot of times schools will still do 1 faculty member to 10, but they'll put 5 students on one unit and 5 students on another unit, therefore requiring that faculty to essentially be in 2 places at one time. They do it well, but it does create an increased stress on the bedside RN. When we're looking at enrollment increases, it is imperative to look at the effect that it has on the community. Is it answering a question? Is it not answering? Is it causing a problem? Is it helping? Is it hindering? So the board has been asked with the new BPC code 2717 after the passing of AB 1015 that we take a look at clinical placements and workforce need. As part of the California state audit, they asked that we take into consideration clinical placements and workforce need. So with that on the agenda item summary, it does say that the program's data varies from what the BRN is reviewed and that it doesn't show the same workforce need. And that happens frequently. We are working to update our data, and we are also listening to our program directors. We've had a college that says that they're located 4 miles from this institution that is having a very difficult time placing students. And then we're looking at approving a new program that's going to add 72 students into that same area. So these are the hard pressing questions, right? The problem we run into this one is this feasibility was already accepted. What that feasibility does is that feasibility says you have the resources. The board has said that there is a need, and that you've said that there is a need, and the board has agreed. And so that the second step that they're in right now is the self-study. The only step that typically happens during this time is the board's already passed the feasibility study saying it's feasible to have this program. The NECs now say, yes, you're in compliance with all rules and regulations. So it's almost like too little too late. But what I do hear happening here, which is great, is the feasibility was approved for 24 students 3 times a year. This program now is asking 30 students 3 times a year, which changes that enrollment number from 72 annually to 90 annually. So you are taking that into consideration. You are adjusting that down to have a lesser impact. We do hear that there are alliances made between various healthcare institutions and various academic institutions. One was referenced here today, where the nursing program director said, I'm having difficulty placing students at my historical sites. When I was a program director, we called those squatters' rights. And so you have long-standing contracts, long-standing relationships, and you can pretty much guarantee that you can count on having a clinical site there. And that is relied upon for many, many, many of our nursing programs. What's also alluded to is that private institutions have a higher enrollment number. That is accurate. That is absolutely true. We have the data to back that up. They have more resources. They have more funding. Therefore more faculty, and they could pay them better. They do charge the students differently than what comes from a community college. And so they can support a higher enrollment number. That doesn't say that they're favoriting private colleges, but because they can support that higher enrollment number, A lot of healthcare organizations are looking at the advancement of their nursings. So do they have an LVN that wants to go back to school? If you contract with an organization, they say, we give you clinical sites here if you can teach our faculty, our staff, and allow them to become an RN. If they have an RN to BSN program or an RN to entry-level masters, again, because they can have a higher enrollment number, they're able to have these agreements that say, I will work with you. One prime example was Glendale Career College partnered with Grossmont Hospital in San Diego, and they have agreed to enroll their students into their program to advance their nursing education at that hospital site. It's a wonderful service to that community. What needs to be taken into consideration is there are other nursing programs using that healthcare facility for clinicals. Does it affect them? So this is a very common occurrence that happens in this. It is not an easy answer at all. And it is the board's ask, essentially, to try to do this in a fair and equitable manner. The public comment's great. I do want to give a time for the nursing program to speak on this. And then I will point out that in the materials for the board meeting today on our website, there are board approved enrollment increases from 2019 to 2021 forward. And you can see that this location is looking to start up in the LA area. I can show you that in LA just this year, we have done 4 enrollment increases, and that has increased annually in LA. And I'm not saying greater LA, these are literally just kind of set as LA. We're increasing 20 students annually there. We are increasing 90 students annually on that one, 20 students and 80 students. So in LA only, not talking about Orange County, not talking about the greater LA area that goes out to Ontario, et cetera. We have 210 new nursing slots having to be absorbed by these healthcare facilities on an annual basis for students to come through. If I were to add in Orange County, there was another increase of 70 and another increase of 125. So if we take in Orange County with 70 and 125, we're at 405. If we go into the greater LA area, that includes out to Ontario. Ontario at 120 and 125 also. So now we're at 650 in the greater LA area of new clinical spots just this year approved by our board on an annual basis. So these are in here. We're trying to get the data out so you guys can make informed decisions so that you can see this. And it's a great communication. So let me know if you have any more questions and we can kind of go through this. And I do absolutely want to give the program the ability to speak. So I know that a lot of people talk about private versus community college. There are benefits and negatives to each one of those. And this is the conversation that it occurs. Thank you.
Judy, are you available? Or Mark, can you elevate Judy Corliss, please?
We still have other people that want to comment.
Okay. Well, I mean, she's the program.
We're still in public comment, right?
Yes, we are. Okay.
Okay.
You're right. My bad.
That's okay. I just wanted to make sure. Amy, we're going to try Amy one more time. Oh, wait a minute. Did I lose her? Oh, there she is. Hold on. Here comes Amy. Go ahead, Amy.
Can everyone hear me now?
There you go. Thank you.
Thank you so much. I'm so sorry for the tech issues. Thank you so much for this opportunity. I just wanted to add that it's very impressive that we're adding 44,000 nurses to the workforce. I'm all for that. I'm currently the department chair for the School of Nursing at Golden West College, and part of my role is to secure staffing and clinical placements. I know that this has been a long topic. I just wanted to say that placements were rough pre-pandemic, and in this post-endemic world that we're entering, the difficulty has multiplied significantly. I'm highly concerned that yet another nursing program that is 4 miles from where we are located is going to be entering, as placements are really truly very distressed in our level. I've always been a firm believer in affordable education that results in gainful employment that serves the local community. And I really truly believe that the open door philosophy of community colleges allow for this and gives underserved minorities within nursing new opportunities. And I feel that the partnerships that we have with our existing clinical placements are crucial, and yet we're still struggling on our historical crucial placements. Again, the school is located 4 miles from us. I feel that the bottom line, people of the state of California want an affordable education through a community college, and I just wanted to thank everyone for my time.
Thank you, Amy. Berlin Ching would like to make a comment. 1 second, please. Go ahead. Hello, go ahead. Sorry. VJ Bhaskar is on here. That's part of the SSK group. Did you want to have them comment now, or do you want me to elevate them and then they'll comment?
Either way, they just want to comment. I did send a thing for them to. They sent me the person who, I think it is VJ, that they were going to be on there. So it doesn't matter. They're all together, I believe, in the same room. So if we can just open a mic for them, they should be good.
Okay. All right.
Thanks so much.
Go ahead. SSK, go ahead.
They're also telling me Judy Corliss is in the public comment. Can you see her there?
No, ma'am, I do not.
Okay.
And they are allowed to speak. They're not speaking though.
Can you tell if they're on mute?
They're unmuted.
Unmuted. Okay. I know Donna there, NEC can hear us, so I'm sure she's working with them.
Okay.
Behind the scenes. Was there anybody else on public comment?
Let's try Berlin Ching again.
Okay.
Berlin, I send you a request. You have to okay the request. Hold on here. Sorry. I lost her. Oh, now Berlin Ching is gone.
Berlin, I think she's saying she can't get unmuted. There's a padlock on
Right
it,
there. There's no, we send the request and it pops up on their side and they hit the button. She is not on the list anymore. She's gone. She must have disconnected. Reuven Cohen would like to make a comment. 1 second, please. Go ahead, Dr. Cohen. Dr. Cohen, I've sent a request to unmute. You can unmute. Oh, Dr. Cohen cannot unmute themselves either. I have no other public requests in here. Would you like me to close it, or would you like to wait?
That are requesting public comment, are they all associated with this school?
I don't know about Chen, but I think Dr. Cullen is, yes.
Okay. Mark, are you able to go through the attendees list and elevate them all to panelists so that they can speak freely, please?
Let's see if that works. Oh,
I did hear somebody come.
oh, there he is. There he is. Keep going.
All right, I think I'm unmuted now. This is Dr. Reuben Cohen. I'm the Program Director for General Education at SSK Institute. And also, I am the former fiancé of Dr. Diana Sherlin, who is well known to this board for many programs that she began, unfortunately passed away tragically in October of 2021. But what I wanted to say about that is that Dr. Sherlin, and I recall those days when she was enlisting clinical placements, did a lot of work to try and find clinical placements that were not in competition with any other schools. And we have submitted, a very large pool of clinical faculty for placement. So I don't think that it's entirely fair to say that we're in direct competition. Also, I would say that the history of SSKI is that it has had wonderful programs for training LVN nurses, as well as medical assistants, nursing assistants. And almost all of the initial waiting list of students are for the RN program are graduates of these programs that already have been working in different facilities, and many have used those facilities for clinical placements. So as was pointed out earlier, in our feasibility study, these were all approved, and it doesn't seem quite fair to be bringing this issue up at this time. I'm sorry that our president and CEO and our other directors couldn't get on. They're in a room at the college, and for some reason, I guess can't get unmuted. But thank you very much for giving me the opportunity to speak, and I hope this is of some interest to you.
Colin. And again, our deepest sympathies for your loss.
Thank you.
I've elevated.
Thank you.
I've elevated the group, so they are free to mute, unmute.
Donna, would it be possible for you to get them on the phone, and maybe you could unmute and they could speak that way?
Donna Schutte has been elevated to a panelist, so she can unmute and speak here as well.
Yeah, my understanding is they want to speak, so.
They've unmuted. You just can't hear anything.
Do is just talk through my phone. Okay. So are you still there? Can you still hear me?
Yes, we hear you, Donna.
Okay. And Judy Corliss, I'm going to have you speak now. I'm just going to put my phone up to my microphone on my computer. Okay. Great. And here she is. Can you all hear her?
Can you hear me now?
Yes, go ahead, Judy.
For some reason, our mute is not working. Can you hear me?
Yes, we hear you.
Yes.
Okay. All right. So I just want to say that when we put the program in, to begin with, it was during COVID. And that is why Dr. Sherlin asked for 24, due to the clinical sites only accepting a very few number of students. So when we got 340 slots for our clinicals, which Donna has fully been there, she's approved them all. That is why we asked for the 30, so we can have 3 clinical groups of 30, due to the fact we have an abundance of clinical sites that will not displace anyone, including Golden West College. And our sites are not anywhere near the 4-mile radius of where the school is located. We've taken sites all around the greater Orange County and Los Angeles area where nobody is going to be displaced. I'm a former board member of the VRN, and I, for one, really understand this displacement issue, and I was on the board from 2009 to 12, so I'm fully aware of Alice's concerns and everybody. And this particular school, I would have not gone to work for them if I hadn't seen that they put out very fine students with 100% pass rate for years. Every one of their students paid their loans and everything with no default and 100% placement in jobs. So I don't know, where all this displacement is coming from, but it will not come from this school, I guarantee you. So, and I've been involved in helping them get clinical sites as well. So I just want to assure the board of that fact. I do appreciate you being able to be patient with our situation. We have 3 computers, and for some reason, none of them would unmute. So anyway, if you have any questions for us, I have our director here and the owner, BJ Bhaskar. Okay. And so we do want to see if we can get that 30 student instead of the 24 due to the, what we had stated.
Thank you, Judy.
So sorry about the technical issues.
Okay. And I'll give this back to you, Mary Ann.
Yeah,
Sorry,
thank you so much.
Committee Chair Dominguez and Mary Ann, Dr. McCarthy, there are no other public requests for comment. Would you like me to close this?
Yes, please. Thank you. And I'd like to take a vote. I, Jovita Dominguez, votes yes. President,
Jovita,
I'm sorry.
Can you tell me who the second was, who the first and second was?
I believe it was Dolores.
So,
Dolores.
Jovita, you made the motion, and Dolores, you seconded it?
Yes.
Thank you very much.
I'd like to take a vote. Jovita Dominguez, yes. President Trujillo?
President Trujillo votes yes.
Vice President Fagan? Susan Aranjo?
Susan, yes.
Imelda Ceja Bakowitz? Betty Woods?
Woods, yes.
And Trisha Nguyen. Thank you. Motion carries. I believe that'll take us to
Thank you very much. Thank you. Thank you so much. Agenda item 8.5, Nclex update. The Nclex report is included in the materials packet for your review. This is an information-only agenda item. There are no significant changes to the report for California at this time. There won't need to be any vote for this. This is information only.
Right. Should we take it to public comment?
Sure. Every agenda item. Yep.
Thank you. BRN moderator, would you take us to public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. And this takes us to 8.6.
Thank you so much. Agenda item 8.6 is the licensing update. The licensing the licensing report is included in the materials packet for your review. This is an information-only agenda item. Items of significance were addressed by Loretta Melby, EO, in her executive officer report.
Thank you. Anybody have any questions? BRN moderator, would you take us to public comment?
We will be open for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no other public requests for comment. Would you like me to close this window?
Yes, please. Thank you. And this concludes 8.0, and I believe we will be going into 9.0 with Imelda Ceja-Bakowitz, Chair of Enforcement and Intervention Committee.
Do you need a break or we can move on? Is everybody okay?
I think we can take a 15.
Okay.
Thanks, Imelda.
3:30?
Board staff has asked for maybe 10 minutes, although 8 minutes, so we can have an even number to come back. If 3:30 will work, that's great. If not, we can extend it to 3:35.
3:30 is fine. Quick bathroom break. See everybody back at 3:30. So I could probably get ready to do roll call. Let's see if a few more people pop in before I do. Oh, looks like everybody's on. Actually, do I really need to do roll call? It really looks like everybody's on. Lori?
It's always good to do roll call coming back from a break.
All right,
Just make sure we have it.
Dolores Trujillo is present. Vice President Mary Fagan. Imelda.
Imelda Ceja-Bakowitz here.
Jovita. Susan. Elizabeth Woods.
Woods here.
Trisha Wynn. Jovita.
Hi. Yes, I'm sorry.
All right, we're all present. Go ahead, Imelda.
And item 9.0, report of the Enforcement and Intervention Committee. My name is Imelda Ceja-Bakowitz. Moving along to 9.1. This is overview of the Enforcement Division and Investigation Unit. I believe Shannon Johnson, BRN Enforcement Chief, will join us.
I'm here. Thank you, Imelda. Hi. So I am going to be giving an overview of the enforcement unit. My name's Shannon Johnson. I'm the Enforcement Division Chief, and I will be presenting both enforcement and investigations. I'd love to hear any questions that you may have, and there's going to be an opportunity when I'm done at the end of the presentation. So for the objectives today, excuse me. For the objectives today, we are going to be going over the overview of the BRN's enforcement process. Next. Cover what triggers complaints and investigations, what can be expected during the disciplinary process, and the types of discipline outcomes. So these are some of the common terms that are used. The respondent is always going to be the RN or applicant. The complainant is going to be Lori. It's always the executive officer. The Office of Attorney General prosecutes the board's cases, and the Deputy Attorney General is the attorney assigned to prosecute the cases. Our cases are heard by an administrative law judge in the Office of Administrative Hearings. And a statement of issues is the pleading filed for an applicant. And interim suspension order is ordered by the administrative law judge on the administrative courts. A suspension that has been ordered by a criminal court judge is referred to as a PC 23, Penal Code 23. Am I talking loud enough? I had somebody say that they couldn't hear me.
You're kind of going in and out.
Let me turn off my video. I apologize. I'm going to turn off my video and just see if that helps a little bit. Did that help at all?
Keep going.
I hear you. Yeah.
Okay, next slide. So we have several units within the enforcement division. Intervention is not considered enforcement, but is housed under the enforcement umbrella. Investigations works closely with enforcement, but is not under the enforcement umbrella. Next slide. The board's mission is public protection and pursuant to Business and Professions Code Section 2778. The protection of the public shall be the highest priority for the Board of Registered Nursing. Slide. So I'm going to start with intake. Next. The caseload that comes into complaint intake unit consists of licensees that are arrested and or convicted, public complaints of unprofessional conduct, incompetence, negligence, and gross negligence. We also receive applicants from our licensing unit that has either disclosed another disciplinary action against another healthcare license or criminal history. Even if the criminal activity is not disclosed, it may come up on the fingerprint record that is supplied to the board at time of application. Next. What triggers a complaint? The caseload that comes into the complaint intake unit consists of licensees that are arrested, public complaints of unprofessional conduct. Oh, I guess I already did that slide. Hang on. As you can imagine, we receive complaints from many different entities, such as patients, family members, employers, other state agencies, and law enforcement agencies. When complaint intake receives a complaint and there is an aspect of either substance abuse or mental health issues, the case will be referred to the intervention unit and they will be offered the intervention program as we simultaneously investigate and obtain records. Next. So I'm going to talk a little bit more about our intervention program. So in 1984 and 1985, the California Nurse Association, BRN, and lawmakers collaborated to create the BRN's intervention program, which was previously called the diversion program. In January of 85, the program was signed into law, and this is a voluntary program and completely confidential. Next, in order to be eligible for the program, you must be licensed in California without previous discipline or terminated from an intervention program for substance abuse or mental issues or illness. There are two types of referrals into the program. So the RN can self-refer themselves without having any complaint filed against them, and the board will send a letter of invitation into the program when a complaint has been filed and involves drugs, alcohol, or mental health issues. There is an intervention evaluation committee that oversees the care plan for each participant. This consists of 3 registered nurses, a physician, and a public member, and they all must have a background in chemical dependency and or mental illness. Currently, there are 14 intervention evaluation committees across the state. They meet on a quarterly basis, and there's about 15 to 30 participants assigned to each IEC. Next. Let's see here. So we'll move
You're going in and out again.
I'm going in and out again. I'm sorry.
That's okay.
So we're going to go to investigations. So complaint intake also refers cases to investigations if needed. We have 2 investigation units for our cases. There is the internal BRN investigative unit, which are our non-sworn investigators, and they work most practice and patient care complaints. There is also Department of Consumer Affairs Division of Investigations, and they are sworn law enforcement. They work the more egregious cases that have either a patient harm or a criminal element to them. Some of the causes for an investigation are diverting of drugs from the employer, intoxication on the job, arrest and convictions, any dishonesty, which would be theft, fraud, pre-charting, attempting to cover up charting errors, falsifying medical records, or falsifying certifications. Additional causes for investigation could be repeated medication errors, not advocating for patient safety, failure to follow infection control guidelines, providing medication to family, friends, or coworkers, patient abandonment, and also refusing to give handoff to the incoming nurse. Once an investigation is complete, it's referred back to the complaint intake unit, where an analyst then reviews to determine the next steps. So we may close the case if there were no violations found. We send the case to an expert for review if the incident involved patient care and scope of practice. If there were findings that don't rise to the level of formal discipline, we may send the case to our citations unit to issue a citation. If findings were violations for formal discipline, we would then transmit the case to the Attorney General's office. When there are criminal elements, Division of Investigation will refer the case to the district attorney if warranted. If the RN has entered the intervention program, we will put the case on hold. If the RN completes the program successfully, then we close our case. But if they leave the program for any reason, the board continues on with the disciplinary process. So we'll move on to fine. So what is a citation? If a case doesn't rise to the level of formal discipline, the case will be sent to the citation unit. And this is an informal administrative action. Some examples of what we cite for are first-time convictions, out-of-state disciplines, minor practice issues, fingerprint noncompliance, failure to update their address of record, and unlicensed practice. Failure to update address of record is really important to us in enforcement because a lot of our items are time sensitive. For instance, when we file an accusation against a license, they have 15 days to file a notice of defense, which is their appeal to their case. Should they have not changed their address of record, we wouldn't be able to get that to the appropriate location. And therefore, that could cause the RN's license to go into a default revocation. So the failure to update the address of record is very important. There is an appeal process both informally and formally. There are exceptions to when the board can't issue a citation. So if the violation is of a severity that revocation or restriction is necessary, we will then elevate it to discipline. This includes physical abuse, neglect, abandonment, fiduciary abuse, deprivation of care or services, which are necessary to avoid physical or mental suffering. And these types of cases will be transmitted to the Attorney General's office for formal discipline. Citations are not published public record, but if requested, the BRN is obligated to provide these documents. However, citations are purged 3 years from the date of resolution. So for instance, if there was a fine associated, it would be the date that the fine was paid in full. If there were courses Another thing I want to mention too is if they can't pay it in full and they do have a financial hardship, the board will take that into consideration, and we do have the opportunity to extend that renewal for 1 additional year to allow the RN to complete their fine payment. All of our unpaid fines are sent to Franchise Tax Board for unpaid citation. So I will go into our disciplinary process, which is our formal administrative action against a license. There are 2 types of emergency orders that the board can pursue. If the licensee has been arrested, the board has the authority to appear before a criminal judge and request conditions be placed on a license. The judge may then impose those conditions, or they can decline our request. If the judge places conditions on the license, it is immediately posted to both the board's website and to NERCY's. This order is in effect only until the criminal proceedings have concluded. So that's why it's very important that BRN move fast with their administrative process. If the criminal judge doesn't order the Penal Code 23 restriction, or if there's been no criminal hearings that we have to go in with a PC 23, we can pursue a suspension through the administrative court and request an interim suspension order, or called an ISO, from the administrative law judge. So when it appears that practice may be impaired due to mental or physical illness, the board can also order the RN to be examined. This exam may be used as evidence in proceedings conducted if the RN is found to be unsafe. The board may then pursue disciplinary action, including revocation, suspension. We could place the RN on probation, or other action deemed appropriate based on the disciplinary guidelines and the outcome of the order to compel to that exam. Once the case is received from complaint intake, it is prepared by our discipline unit and transmitted to the Attorney General's office. Within a couple weeks, the case is normally assigned to a Deputy Attorney General, who then prepares the pleading or order to compel. And when I say pleading, again, that would be an accusation for license, the statement of issues for an applicant. They also prepare our petitions to revoke probation, and then our orders to compel to a mental health or physical exam. For an accusation, the licensee has 15 days to file their defense, as I mentioned earlier. An applicant has 60 days to appeal the denial of their license once the statement of issues is filed. All of these documents state the cause for action, or if it's a probationer, it states the violation of probation condition that was not met. They're all published documents to both BRN's website and to NERCY's. So the respondent is permitted to present mitigating circumstances during settlement negotiations, and at hearing, respondent may choose to have legal representation in either situations, but it's not required by the board. The possible outcomes of the case could be public approval. This is the lowest form of formal discipline. This usually includes cost recovery for the cost of the investigation and prosecution of the case, and possibly courses depending on the reason for the disciplinary action. Could be probation. We usually have 3-year probation terms and apply conditions dependent on the reason for the disciplinary action. So these conditions are laid out in our disciplinary guidelines as well. It could be a surrender of license. So if an RN, if the RN surrenders their license, they will need to wait 2 years to petition the board for reinstatement of the license, and 1 year if that surrender was for a mental or physical illness. We also have revocations. These could be an ordered revocation by administrative law judge, or it could be a revocation by default. A revocation happens when they do not provide their notice of defense to the board within 15 days. And just so you're aware, we do give them extra time for USPS. So normally we try to wait about 35-40 days. We do, I believe we do give them 25 days for USPS with the 15 days. So you're looking at 40 days. An applicant can have a denial of license for either not appealing the denial. So just an outright denial if they did not appeal the denial in the beginning, or if it's ordered by an administrative law judge. An applicant also has the option of withdrawing their their appeal of the denial. So if they appealed and then they decide they don't want to go through the disciplinary process, they do have an opportunity to withdraw their appeal. And the board also can possibly withdraw pleadings and no disciplinary action taken. And a lot of time that happens if we have other mitigating evidence that comes into play after we have already filed a pleading and come to the determination that we do not have evidence to prove that there is a violation of the Nurse Practice Act. So as I mentioned, all settlements that are negotiated prior to hearing as a stipulated agreement by our discipline analyst or by a proposed decision from the administrative law judge, all of them are made pursuant to the recommended guidelines for disciplinary orders and conditions of probation. And on this slide, I've put the link as well. If you would like to find that, you can also go to the board's website and type in the search engine disciplinary guidelines, and that is the first document that does come up. In the current guidelines, the uniform standards, we have not incorporated them yet. However, we do follow the uniform standards and are working on currently updating the disciplinary guidelines to incorporate those uniform standards in their entirety. Probation. So the purpose of a probationary term is to first and foremost ensure public protection while enforcing all of the conditions in the decision and order. We try to ensure that probationers have the tools to comply with their conditions and at the same time take any additional action if there's either a violation of one of their conditions, which would result in a petition to revoke probation, or if there's any other violation of the MPA resulting in an additional accusation. For example, if the probationer happens to get an arrest based on criminal activity, that would be another cause for an additional accusation. With disciplinary guidelines, there are applicable conditions of probation, and they're broken up into two groups. There are standard conditions of probation, which apply to, I'm going to say most probationary cases, and it includes conditions 1 through 13 that you see here. And the only time that all of these conditions don't apply is, for the most part, an applicant case. We do not recoup cost recovery on an applicant case. And there's not any ordered. And also when we do an 820 exam, we do not recoup the cost for compelling them to a mental psych eval. However, if we do go through the disciplinary process, the board does have the authority to recoup cost once we file a pleading. The second set of conditions are optional conditions that may be applied if there is a substance use or mental illness. And that would include conditions 14 through 20, which include the physical mental exams, abstaining from any substance, submitting to tests and samples, going to therapy, and then we can also add in an actual suspension of license. And normally when we add in the actual suspension of license, it's because we want them to get their physical and mental exams completed to ensure they're safe to practice prior to allowing them to go back into employment. As I mentioned before, noncompliance with any of the conditions of probation can result in further action against the license, including we could possibly do a cease practice if they have had a positive alcohol drug screen. The nurse does have a condition within their probationary conditions that allow them to do a voluntary in-house surrender. If we have a violation, we normally go for revocation of the license and do the petition to revoke. Or if it's something minor, for instance, they're having problems complying with either their cost recovery or maybe they are having a hard time finding a job. Within those orders and the disciplinary guidelines, the board does have the authority to extend probation up to 1 year for them to comply. So that concludes the overview, and that was a very high-level overview presentation. And if you guys have any questions at all, I'm here to answer them for you.
I know that that was kind of a long presentation, and thank you very much, Shannon, for being there and being available to do that. The reason that we put out these kind of teachings in our board meeting is one that was part of our strategic plan, is to provide more teachings to our board members and our public through this venue, as well as we've had several questions where people have reached out and said, I have filed a complaint against so-and-so, how come nothing has happened? And that's the kind of the biggest question that I receive. I get that from hospital chief nursing officers. I get that from patients' families, from many, many people. And they say, I filed a complaint, what's next? And so Shannon, can you give just a real quick, just from when we receive the complaint, we do receive it via email, I believe, is that correct? Or by mail, that we do not do phone complaints? And can you just go through that process until we're able to take a license?
So we obtain complaints we do get them through our enforcement email. We do get them through mail still, but the majority of our complaints that come into the board, we get in through Breeze. So they're the online complaints. So someone can go in and file a complaint. They can even file an anonymous complaint. All complaints are taken very seriously. And as long as we have enough information to pursue an investigation, the complaint intake unit will then transfer that case over to our investigative unit, and dependent on the Consumer Protection Enforcement Initiative that was in place by DCA, that will determine where the case goes, whether it goes to a non-sworn investigator or whether it goes to Division of Investigations sworn investigators. So as you can imagine, if that case has any criminal element or patient harm related to it, it will go to Division of Investigations. So normally the process for an in-house investigation, and as you could probably see on the next agenda item summary, there are some statistical information based on each of the units. But roughly, BRN's investigation will take about 170 days on average. Once we get that back, our experts, if it's a practice case, it will need to go to an expert to opine on that case for the level of violation, and that expert has to be an expert within that area of expertise. They have to be currently working for at least 5 years and have been a nurse for at least 10 years. Once we get that expert review back, then we send the case over to, well, if there was a violation opined by the expert, we will then send it to discipline. We usually within 2 weeks have our cases sent over to the Attorney General's office. We do everything via cloud now, so it's all electronic, which gets there much faster. Within a few weeks, they usually have a Deputy Attorney General assigned to the case, and on average, the cases at the AG's offices, I want to say it's about 300 days now. It was quite a bit higher, but it's down to about 300 days. So we have fast track cases. We call them fast track. Those are our paper cases, which are criminal arrest and convictions. And then we have our out-of-state disciplines. They're strictly paper cases, and they usually move very, very fast in the system. Usually from beginning to end, we're looking at about 3 to 4 months. However, if an RN chooses to go to hearing once we file a pleading, we have to allow them due process. We can't just take their license. There's nothing in our laws or regulations that say that they mandatorily have to stop working. They mandatorily have to go into our intervention program. We allow them due process. We do invite them into the program. If they do not choose to go into the program, then we have to go down the disciplinary route, which could take some time. So between an investigation and the Attorney General's office, off the top, you're looking at an average about 470 days on a case that needs to be investigated. So once due process, we allow them due process. They can either settle with us before going to hearing, and our analysts within our discipline unit use our disciplinary guidelines to negotiate what settlement terms we're willing to settle with. And that's usually based on the type of mitigation we've received. For instance, if it was inpatient care, have they taken courses? How many courses? How many hours have they done? What have they done to rehabilitate themselves? If it's chemical dependency, how many years of sobriety do they have? So there's a lot of mitigation that we look at. But unfortunately, we do have to allow them due process. So some of our cases do take a while. If they choose to go to hearing and they do not want to settle with the board, then you're looking at another 9 to 12 months down the road. And especially with COVID and the courts kind of closing down, all of our hearings are still being done via an online platform. So there's another element that gets added to it should they want to go to hearing, which then the nurse's license stays in an active status until we have a final decision in the disciplinary matter. And that was kind of long-winded, but hopefully it made it a little more understandable.
Thank you, Shannon. That was a very thorough report. I've been with the board for a while, long time. And it's always interesting, you forget about certain steps, but, for the new board members, this is a really good presentation. I do have a question. You indicated that you guys don't take phone complaints. I have concerns about that.
No, I shouldn't say we don't. We do. If somebody needs assistance in filing a complaint, we will assist them. However, the majority of our complaints do come in through email, and they are online complaints and mail. We try not to do phone complaints because we want to make sure that the complaint that they are filing with us is in their words, that someone is not writing something down, that they've taken a statement that somebody has said and maybe transposed some words. And that's the only reason we try to stay away from, but we do assist when needed.
Yeah, and that's good to know, because I know some there's language barriers, right? And there's people that are not techie, people that are not comfortable with doing things online or even email. So it's good to know that you do provide those assistance, and hopefully you have translators that can help those individuals. My other question to you is maybe next time a presentation, this was really good, but so we can understand, or so the public can understand how some of those complaints come to us, how they are, when they go to the Attorney General's, which ones are referred to the board members to review, and when we go in closed sessions.
Okay, we can do the whole Attorney General process from the time it's transmitted and how it's filed, and then what you receive to do board vote. We can go over all that if you'd like.
Yeah, just very briefly, because I know normally we don't get the cite and fines.
Right.
There's others that for early termination we get those, but there's certain ones that we don't get. There's a process, and sometimes when they go to the Attorney Generals or before the judge, sometimes we get those as well. So just a very brief overview as to how they're divvied.
and they come in through any means possible, and everything gets funneled through our complaint intake unit. So regardless of how the complaint comes in or where it comes in from, it all gets sent to complaint intake to be opened, coded, and sent on to the next step. But I am more than happy to do that with you. The other item too is we're coming into possibly starting to update our disciplinary guidelines. So the board may be interested in having kind of an overview on our disciplinary guidelines and conditions of probation. We could do that as well, because I know both the NMAC and NPAC were interested in having that presentation as well.
Thank you, Shannon. I think we're ready. We can open it for public comment. I'm sorry, board members, do you have any comments regarding the presentation? And if you don't, moderator, can you please open it for public comments?
Public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Seha Butkowitz, there are no public requests for comment. Would you like me to close this window?
So moving along to item 9.1.2. This is information only, enforcement and investigation updates. Shannon Johnson, it's all yours again.
Yes, so this is the enforcement and investigation update for complaint intake, investigations, probation, intervention, and then as you get down to page 4 through page 9 are the statistical information on each of the units and the comparison of BRN to the other healing arts boards. So if you have any questions, I can answer any questions related to any of those items.
Members, do you have any questions, any comments regarding the report? There's a lot of numbers there. So if you have any questions, feel free to ask Shannon. I think that what I did want to comment is on, we're always looking at how many days it takes to process. And we asked you the last time to provide a table and compare us to other boards. Overall, we're doing great. So thank you. Really
based on our licensee population and the number of complaints we receive at the Board of Registered Nursing, we are in the top 3 of processing time. So I believe that the BRN is doing an amazing job.
We are. Thank you so much for that. And the report, very thorough. Again, board members, do you have any questions regarding the information provided? If not, we're going to go ahead and open it for public comment. Mark, can you please do so?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for a comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. But I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Seha Buckowitz, there are no public requests for comment. Would you like me to close this window?
Yes, please, Mark. Thank you. Moving along to item 9.2, discussion of possible action regarding appointment of intervention evaluation committee members. Shannon, please do the
That's
honor.
me again. So for board members, in accordance with Business and Professions Code 2770.2, the board is responsible for appointing our intervention evaluation committee members. And again, like I mentioned before, the intervention evaluation committee is composed of 3 registered nurses, 1 physician, and 1 public member. So we have 3. We have 2 new appointments and 1 reappointment. So we have Marion Broadkey, RN nurse member in Fairfield, IEC 2. And that term would end June 30th, 2026, if appointed. You have Leonard Howell, RN nurse member in Los Angeles, IEC 14, also a new appointment, which would end June 30th, 2026, if appointed. Then we have Elizabeth Clark, RN member in Fairfield, IEC number 2, and this is a reappointment, and the term would end February 28th, 2026, if reappointed. So I would like to call for a motion.
I will make the motion of appointment of intervention evaluation committee members. The 3 that were mentioned. Can you name them again, please? Shannon.
Oh, I'm sorry. So the 3 members are Marion Broadkey, RN member, Leonard Howell, RN member, and Elizabeth Clark, RN reappointment.
This is Mary. I second that motion.
Comments? Any questions from board members? If there is none, Mark, would you open it again for public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Seha Buckowitz, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you, Mark. Okay, there was a first and a second, so I'm going to go ahead and call for the vote. President Dolores Trujillo.
Yes.
Vice President Mary Fagan.
Mary Fagan, yes.
Elizabeth Woods.
Woods, yes.
Susan Naranjo. Jovita.
Yes.
Trisha Wynn. Thank you, ladies. Also remind everyone, Shannon, I think there's vacancies, so they can always reach out to you, correct?
Yes, on the agenda item overview of the enforcement and investigations, at the bottom is the vacancies that we have across the state with the information on how to apply if you would like to become a member.
Thank you, Shannon.
You're welcome. Thank you very much.
That concludes my report. Moving along to report of legislative committees. I'm going to turn it over to President Dolores Trujillo. Thank you.
Item 10.0, report of the Ledge Committee. Do we have Gurpreet elevated to the panel?
She'll unmute and give her report.
Thanks, Gurpreet.
Good afternoon, members of the board. My name is Gurpreet Kaur. I am the legislative and regulatory analyst for the board. We are currently in the second month of year 2 of the 2021-22 legislative session. In 2021, I tracked a total of 26 direct impact bills and 22 indirect impact bills. To clarify again, the distinction, direct impact bills are those that have an implementation component for the board and can have a fiscal impact. Indirect impact bills fall under other agencies' jurisdiction and typically don't have a fiscal impact, but impact nursing, its education, or practice in some form. 11 direct impact and 8 indirect impact bills were chaptered last year and are not on the agenda. Bills that didn't move forward in year 1 of the 2-year session, which are also known as 2-year bills, are included on the agenda along with 3 new bills, AB 1604, AB 1733, and SB 889. The last day for bills introduced in 2021 to pass their house of origin was January 31st. Consequently, we have a number of 2-year bills which died. A list of these bills is included in the agenda. Since the posting of the agenda, 2 more bills have been added to this category of dead bills. AB 1498 by Assemblymember Lowe, which is noted on the agenda under direct impact, and AB 285 by Assemblymember Holden under indirect impact. I will be presenting the 3 new bills as well as 2 bills from 2021 that were recently amended. Direct impact AB 646 by Assemblymember Lowe and indirect impact AB 1120 by Assemblymember Irwin for the board to consider and to take or modify a position. I also began tracking 3 new bills this week, AB 1662, AB 2104, and SB 1031. The last 2 have just been published. Since these are not on the agenda as per the Bagley-Keene provisions, I can only present them as items for future consideration and vote. We are also still awaiting the sunset extension bill for the BRN. It is expected anytime between today and Friday, February 18th, this Friday, which is the last day to introduce bills. Before I move into the bill's presentation, please let me know if you have any questions for me. Okay.
You can go ahead, Gurpreet.
All right. So I will start with the new bills not on the agenda. These are for future consideration with no discussion or vote at this time. AB 1662 by Assemblymember Gibson, Licensing Board's disqualification from licensure, criminal conviction. This bill applies to all boards under the Department of Consumer Affairs and will allow a prospective applicant that has been convicted of a crime to request a pre-application determination of licensure eligibility. This bill can have a substantial fiscal impact, which is currently being determined. It has been referred to the Assembly Committee on Business and Professions. The next new bill not on the agenda is AB 2104 by Assemblymember Flora, Professions and Vocations. This bill would authorize DCA and each board under it to charge a fee not to exceed $2 for the certification of a copy of any record, document, or paper in its custody. The bill would also require that the delinquency, penalty, or late fee for any licensee within the department not exceed $150. The earlier language required this fee to not be less than $25 and not more than $150. This bill removes the lower threshold for these fees. The fiscal determination is outstanding as this bill was just introduced. The last new bill not on the agenda is SB 1031 by Senator Ochoa Bogue, Healing Arts Board's inactive license fees. This bill would require the renewal fee for an inactive healing arts license to be half of the amount of the fee for a renewal of an active license, unless the board establishes a lower fee. The fiscal impact for this, again, this also is outstanding as this bill was introduced just yesterday. The next 5 bills are for your consideration today. The first 4 are direct impact, and the last is an indirect impact bill. The first is AB 646, Assembly Bill 646 by Assemblymember Lowe, Department of Consumer Affairs Board's expunged convictions. This one was introduced in 2021 and is moving forward this year. It underwent a substantive amendment on January 24th, 2022. The board had taken a watch position in May 2021. You can now reconsider it based on the amendment. So AB 646 adds section 493.5 to the Business and Professions Code. It will require all DCA boards to update or remove information posted on its online license search system about a revoked license within 90 days of receiving an expungement order related to the conviction as specified in the bill. It also requires the board to charge a $25 fee to cover the reasonable regulatory cost and allows the board to adopt regulations for implementation. I am in discussion with the author's office regarding several questions and concerns which can make implementation significantly challenging. The fiscal impact can be determined once we have those answers and the sought clarity from the author. The bill is currently in the Senate and awaiting assignment to a policy committee. Any questions that you might have for me?
So Lori, are we taking a stand as a board on these bills right now, or is this informational only?
We can. You can choose to make any position on any bill that was presented here that we have not taken a position on. Additionally, there were 3 bills, I believe, Gurpreet, I could have miscounted, I'm sorry, that had substantial changes that the board had taken previous positions on. Those, because of the changes, are definitely open to have a position reconsideration if they believe that those changes are concerning, where they would, if they had previously supported, they wanted to not support, or if they had changed it where they had supported it and they choose not to support. So either one, and you can also choose to watch. So Gurpreet, do we have, what are the bill numbers that need a vote, that do not have a board vote at this point, that was agendized?
Because this one has a board.
So this one and the bills that I am presenting now are the ones which were agendized and require a vote, or for your consideration, for the board's consideration now. AB 646 is one of the 2 amended bills that underwent substantive changes this year. So this one had a watch position last year.
I would like to make a motion to continue to watch.
Yeah, I second that. Any questions or comments from the board?
Quick question. So what could you just maybe walk us through what some of the concerns of staff are on this bill?
Absolutely, board member Nguyen. The bill has now is what it's asking. It has 2 components. Adding under BPC 493.5 A1 and A2. A2 would require that if the person is not currently licensed and does not reapply for licensure, to remove the initial posting by the board on its online license search system that the person's license was revoked, and information previously posted regarding arrests, charges, and convictions. So if the BRN, if the BRN receives an expungement order for an applicant who's not licensed or applying for relicensure, and the board removes the relevant initial posting and information pertaining to those charges, arrests, and convictions, and subsequently the applicant applies for relicensure, we are not sure how that process will be handled. Will the board have to pivot to 493.5 A1 and repost charges, arrest, convictions with the expungement order and the date of the expungement order, or how that there's that clarity? We don't have that yet. And there are additional things the $25 fee at the moment, I think we're looking at that. It seems might not be adequate, to cover reasonable costs for the board. And then our enforcement had some concerns as well relating to, the bill refers to expungement under 1203.4, but that apparently is not an expungement, it's a dismissal after complying with the court's initial orders. So there is some lack of clarity on that front as well.
Well, I am comfortable with a watch. We'll get another look at this in May, but at some point, people do look to the board for direction, and if we're sitting kind of passively, we really miss an opportunity to weigh in. So if the board is comfortable with a watch, I am too. As staff continues to work, to get this bill ironed out, but I'm, kind of reluctant to sit in a back seat indefinitely if we really ought to be taking a stand. So thank you very much for that explanation.
Absolutely, you're most welcome.
Thank you, Tricia. This is Lori, the board deal. I want to kind of chime in really quick as well. There's a lot of kind of nuances with this bill that haven't been completely ironed out yet. I think that a watch position right now is appropriate, knowing that we can come back in May. Gurpreet has reached out to the author's office to get some clarification. I am also reaching out to DCA to work with DCA's ledge to get some clarification. They may have had some conversations outside of us. With part of the initial posting, an applicant comes into the BRN, they apply for licensure. Mm-hmm. We do a review and typically we grant them license. It is rare where we will deny them licensure. The reason that it has been notoriously kind of important for us to put that denial of licensure up on our website is they can go to other states. They can state shop. They can find a state that maybe has more lenient laws than we do or such. And kind of go to whichever one would do that. That's obviously not something we see frequently, but we are aware that that does happen. So that was a concern if we were to pull that down. The one saving grace with that I want our board to really understand is we use NCSBNs. We've had a lot of conversation over the last months about nurses and license verifications and endorsement and stuff. So with NCSBN, we report all criminal convictions, all enforcement issues, anything to that, to our NCSBN partners. And they serve also as our national practitioner database, right? And they make that leap for us and turn in all that information. So even if we take it off of our board's website, which we absolutely can do if this passes, that information is still going to be out there. And because now we're moving to the license verification process through nurses, all of that will be contained within them and the states will have that ability. So I'm confident that if it's just removing it off of our website, that would not have a negative effect on the public protection if they're using NCSBN for that. However, we're not confident that that's the end all be all of this. So we do have some questions that we're waiting to get back from the author to be cleared up that we can then provide you some additional information on so that the board can make a really good choice. Some of my staff are leaning towards an opposed position. Some are okay with the watch position. I'm really interested to see how any amendments and play out and what the other people think of when they start reviewing this bill and what DCA thinks too, because this is a DCA wide bill, not just BRN specific.
Thank you.
Thank you, Lori. Go ahead, Gurpreet.
All right. So just to check, Dolores, we have a watch motion on this. Okay.
So do we want to just vote all at one time and go to public comment?
Okay.
You can make a motion if you want to. I know this we've been doing last year with Ledge is you make a motion, you get a second. We do that on all of the bills and we go out to public comment once, and that would be appropriate for time saving today because I do believe we are scheduled to end in about a half hour.
Yeah, we are. Okay, we'll do that. Go ahead, Gurpreet.
Okay, absolutely. The next bill is AB 1604 by Assemblymember Holden, the Upward Mobility Act of 2022, Boards and Commissions, Civil Service, Examinations, Classifications. This is a new bill with no board position. It is identical to AB 105 by Assemblymember Holden from 2021. The board did not take a position on that bill. This bill will require that on or after January 1st, 2023, all state boards and commissions consisting of one or more volunteer members have at least one board member or commissioner from an underrepresented community. This and the bill's numerous other provisions are aimed toward the appointing authority of state boards and commissions and Cal HR. The current fiscal impact is minimal to the board and pertains to a new demographic data collection requirement for all state agencies, boards, and commissions. This bill has been referred to the Assembly Committee on Public Employment and Retirement. Any questions on this bill?
If no
And you said this one, the board has not taken a position on, is that correct?
Last year,
we have not.
There was no position on this bill.
That was similar. Okay.
Any questions or comments from the board?
Well, I think it's a great idea. If we're going to get serious about diversifying our board, you have to start somewhere. And I think this is a good first step. So I would be in favor of supporting a bill like this.
Is that your motion?
I move that we support this bill.
I second you. Okay.
All right.
We'll open up for public comment after we're done with the bills. Go ahead.
Sure. The third bill is AB 1733 by Assemblymember Quirk, State Bodies Open Meetings. This is a new bill as well. This bill makes changes to the Bagley-Keene Open Meetings Act and will require all open meetings to be held by teleconference. It would allow for use of teleconference in closed sessions and would remove existing provisions of the Act that require each teleconference location to be identified in the notice and agenda and be accessible to the public. Amongst the various other provisions, the bill would require members attending a meeting from a remote location to disclose whether any other individuals 18 years of age or older are present in the room as specified in the bill. If a state body discovers that a means of remote participation required by these provisions has failed during a meeting and cannot be restored, the state body would be required to end or adjourn the meeting, take specified actions to notify participants, communicate when the state body intends to reconvene the meeting, and how a member of the public may hear audio of or observe the meeting. The bill would also exempt a board from the requirement to meet both in Northern and Southern California once a year if the board's meetings are held entirely by teleconference. If the board determined that a physical meeting is needed, it would be required to hold two meetings, one in Northern California and one in Southern California, within the calendar year. This bill has an urgency clause and would take effect immediately upon chaptering. The provisions appear to offer cost savings to the board. The way it is presently written based on reduced travel costs and conference expenses. The bill is yet to be assigned to a policy committee in the Assembly.
It is the bill that I was talking about in my EO report. And when not in my EO report, but when we were talking about changing the calendar. The board has voiced that their support, DCA has voiced their support within our kind of communications here as staff. And so I would ask the board to take a support position.
Any questions or comments from the board?
I move to support this bill.
Yeah, I'd second. This is
I
Mary.
second it.
Second that.
Mary beat you, Dolores.
She did. Okay.
Go in meetings other than the ones online.
Unless there's a caveat there that she mentioned.
Yeah, so how I see this playing out is that we would continue in the WebEx manner that is going right now. We have that ability to do though, and it has worked wonderfully for the past 2 years. and our board meeting attendance has skyrocketed. There's some days we have over 200. Today we had over 100 in attendance here at our board meeting. And that's not what we ever had when we did in person, unless we invited a school to attend. And so I truly feel that it is a benefit that we keep these remote and we open them up in a manner like this. I also know that, Dolores is a bedside nurse. Having her try to travel and get away from where she's at may be difficult to come to Southern California. I know that Dr. Mary Fagan is chief nursing officer of a hospital here, and it may be difficult for her to get away and get up into a location as well. So this really does take into consideration so many things that have affected our board over the last 2 years. And so I do feel that we will continue, if this passes, to take our board meetings in the manner that we have. Now, any board member that wants to go to a public location and have that teleconference from there absolutely has the ability to do that. If we notice it, that is an in-person meeting, and all board members say come to Sacramento because our board president says, hey, I'm in Sacramento, I want everybody to come and have an in-person board meeting. That means we do have to have an in-person board meeting where all board members attend in the South as well. We do have a business professions code that requires alternate locations. This is also called out in the writing of this bill. That is up for discussion if or when this passes. What I do want to make sure that people know is we are required in statute to have 4 meetings a year. So that's one board meeting every 3 months. And if we do one, that means we're going to be doing 2 in person, which means half of our board meetings would be in person, half would be as a WebEx. But that is something that our board and our admin committee could discuss and vote on if that happens. But I can tell you the last 2 years, I've seen greater attendance and greater involvement with our stakeholders having it in this remote manner.
This is Imelda.
Definitely have seen the interaction with public comment increase since we started meeting in person.
Yeah, this is Imelda. I agree, but I also think it's important that we have the open forum for our hearings and the student orientation. I think that's very beneficial, even if we do those, once in a while, because I think the students very much benefited from that, the orientation, and to see what the process is all about. And, most of them were in shocked, to see some of their colleagues going up there and, pleading, asking for their license to be reinstated. So I think that's a very important part of the meeting. So I would like to continue that somehow, some way. I don't know how that can be done virtually, but
so that's a little bit different. That was discipline day, and that is separate from our specific board meeting. And I know that there was some differences done during the pandemic to allow for that to continue. And I can actually reach out. I know that Shannon was on and kind of talked about that last board meeting as to why those changes happened. But Imelda, we can work on that. But that is actually separate from this board meeting. That was the discipline day that happened the day in advance of our board meeting. And yes, our students loved it. I remember when I went as an NEC and I was orienting and I heard that, it blew my mind. Something I had never ever experienced. So it is a huge benefit to have that available to them.
Any other?
So we have a first and a second. If there are more,
I think there's one more bill, isn't there?
One more bill?
Yeah, 889.
A direct impact, one more, and then there is an indirect impact as well.
Yeah.
Okay. The fourth bill is SB Senate Bill 889 by Senator Osho Abog, nurse anesthetists. This is a new bill, also with no board position. This bill would allow a nurse anesthetist to administer general anesthesia or deep sedation to dental patients if the nurse anesthetist receives a permit from the Dental Board of California by providing, among other things, evidence that the nurse anesthetist has met specified educational requirements. The bill would also authorize a nurse anesthetist to apply to the dental board for an endorsement to perform general anesthesia or deep sedation on a child under 7 years of age in a dental office. All practice allowed by these provisions must be in accordance with the Dental Practice Act and the Nursing Practice Act. The present fiscal impact is minimal to the board, and this bill has been referred to the Senate Committee on Business Professions and Economic Development.
And this is dental practice only, correct?
It is. So this is Lori. Real quick, within our we have a provision in BCP, our Business and Professions Code, where we talk about dentist and nurse anesthetist, and it says that nurse anesthetist can provide service to dental patients in a dental office as long as the dentist has the permit. The ask with this is to allow the nurse anesthetist to hold that permit. That completely is managed through the dental board and other agencies, not the BRN. There is no scope of practice change at all to our nurse anesthetist as far as the BRN is concerned with this. The nurse anesthetist still provides the same care through the same route, using the same medications with the oversight of a dentist that is there, that it under the Nurse Practice Act, a dentist can have oversight over an RN, including a nurse anesthetist. The change is whether or not the nurse anesthetist can hold their own permit, or whether through the dental board, or if the dentist continues to be the one to hold the permit. There has been a lot of discussion about rural and accessibility to care, and that was one of the points that was brought up with this bill, was that this would allow for nurse anesthetists to have permitting process, and their intent was to be able to bring this service to more people, because more people can have the ability to permit. There are some dentist office that would like to offer anesthetic options versus analgesic options only for dental procedures, and they are unable to have a dental permit, anesthetic permit, because they don't meet some of the criteria. The nurse anesthetist can then hold that permit at that time and provide that services in that dental office. And so that's some of the conversation that's been going on around this bill, and I just wanted to share that with you so you guys can make a decision.
Lori, do you know how the dental board they support this bill? Do you have any feedback from them?
I haven't heard anything specifically. Gurpreet, have you?
Thing, and it's still to go to the committee and for positions to be posted on a committee analysis, but yeah.
Any other questions or comments?
I mean, I think Imelda's comment was really good. It'd be really interesting to know how the dental board feels, if they're behind this, or if there's any objection on their part. So it does. She mentioned doesn't really impact the Nurse Practice Act at all.
No, it doesn't.
Can we do a watch on this one till we get a little bit more information?
You want to make the motion?
I would make a motion to watch this bill.
This is Mary, I'll second.
Okay. All right. So the last bill is an indirect impact bill, Assembly Bill 1120 by Assemblymember Irwin, Clinical Laboratories Blood Withdrawal. It was introduced in 2021 and is moving forward. It underwent a substantive recent amendment. The board had taken an opposed position on this bill at its meeting in May 2021. The board can reconsider its position based on the January 3rd, 2022 amendment. This amended bill would authorize a certified phlebotomy technician to collect blood through a peripheral venous catheter, as opposed to the earlier language of by means other than venipuncture or skin puncture under specified conditions, including that the blood collection is performed under the general supervision of a physician and surgeon, and the blood collection is performed using a device or devices approved by the United States Food and Drug Administration. It requires that the blood collection procedures or protocols are approved by the licensed facility, and the technician has been sufficiently trained by the facility to perform the procedure. This paragraph does not authorize the technician to manage, stop, or restart a patient's active intravenous infusion or insert or remove a peripheral intravenous catheter. A physician and surgeon or a registered nurse may restrict or limit a technician's ability to collect blood from a peripheral venous catheter of a patient. Subparagraph B does not authorize a technician to withdraw blood through a peripherally inserted central catheter or central venous catheter. There is no known fiscal impact to the board at this time. This bill is in the Senate and awaiting assignment to a policy committee.
So this is Lori again. I'll shed some light on this too and just kind of give you what we are discussing around this. The board president and I met with the author on this because there was a lot of concerns and the board opposed this initially. When we met with the author, it was clear that this was a specific device that was brought to their attention to get it approved in California. The device is approved in California. It does not need this bill to pass for this device to be used. This device is amazing. It decreases the blood clotting and having to redraw the patient. It's easy. There's no needle sticks. The patient experiences no pain with this. It's a fantastic device. What this bill does, though, is it opens it up to non-RNs using this. And that was the biggest opposition that our board had in the past, is having this opened up to non-RNs using this device. Some of the discussion was to narrow the scope of practice because they just said by means other than venipuncture or skin puncture, that left it open to many things. There also wasn't any clear delineation on whether or not they could use this device to access any central lines, et cetera, therefore increasing the risk to the patient. So through a lot of discussions, they did make some changes. But one of the main discussions that we had is why can't an RN use this? And why does it have to go to a phlebotomist to be used? That came down to conversation of time. So they shared with us that RNs are inundated. We've heard that RNs are inundated and they would like to have the blood draws that routinely occur during their shifts to still be managed through the phlebotomist. So to not have an RN do this, that some of the people were saying, why add one more item on to an RN who is already taxed? Some of the other kind of comments around that is only an RN should be accessing a device to be able to withdraw blood. Additionally, it requires a flush pre and post, and only an RN can do that, can do an IV push pre or post and do that. There was conversation in that meeting that there have been laws in other states that have made provisions to allow for a phlebotomist to give that pre and post flush. That is not something that is within the BRN's purview at this point, and that currently it is only done by an RN. So those are some of the conversations for this and against this and some background on this. Remembering that the board previously opposed this. There has been amendments, but there are still concerns with this bill. Those are the ones that I shared, both in opposition and both in support.
Thank you, Lori. I would like to make a motion to continue to oppose this bill.
Tricia Wynn seconds.
Thank you, Tricia. Okay. Does that wrap up the bills, Capri?
Yeah, yes, that is all the bills. And, if you have any questions on any, the list of failed or dead bills, including AB 1498 and AB 285 and ones listed on the agenda, please let me know if there are any questions, in that regard as well.
If there are no other questions, Dolores, you can open it up to public comment for all of these positions that we've taken on the bill.
Yes. BRN moderator, can you please open it up for public comment?
For public comment now, I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, I would like to make a comment. Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, I would like to make a comment. Monica Miller would like to make a comment. One question. 1 second, please. Go ahead.
Monica Miller, representing the California Association of Nurse Anesthetists. I want to talk briefly today about SB 889, which is our sponsored legislation. First and foremost, your staff has been very gracious with their time over the last few years, quite frankly, that we've been working on this. We've actually been working on it for about 5 years, but we are very appreciative of Loretta Melby's time and your staff's time to work on this issue. There was a question with regard to where the Dental Board is. Dental Board of California actually heard this particular piece of legislation last week, and they did take a watch position. They still have some questions. We're continuing to work with them on some outstanding issues. They have also been incredibly gracious with their time, so we appreciate that. This bill is simply intended to allow for CRNAs to obtain the dental permit. Therefore, a dentist would not need to. As you know, this permit is cumbersome. Providing anesthesia services is not an easy task. And so this would really provide dentists, particularly in rural communities, the ability to offer this services, particularly with the pediatric community and the medical community. So there is access to ensure that these patients have the access that they need to get the dental services that they need. It would not say that a dentist could not obtain this permit. It would just simply provide another opportunity for the dentist to be able to utilize this service without obtaining that permit. Happy to answer any questions. And once again, we thank all of you for your time and commitment to the BRN.
Thank you. Saskia Kim would like to make a comment. 1 second, please. Go ahead.
Saskia Kim of the California Nurses Association. Thanks for the opportunity to speak. I just wanted to briefly touch on AB 1120 and express our opposition to the bill by Assemblymember Irwin, which is a reintroduction of a bill that the board previously opposed, which was AB 822 of 2019. The most recent amendments, unfortunately, do not address our concerns. AB 1120 would allow the use of unlicensed and inadequately trained phlebotomists to access indwelling IVs for the purpose of withdrawing blood from patients receiving infusion therapy. This procedure is beyond the scope of phlebotomists and poses a threat to the health and safety of hospitalized patients. Current education requirements do not prepare phlebotomists for the care and management of peripherally inserted intravenous catheters. Instead, the starting, stopping, flushing, evaluation, and restarting of IVs, as you heard today, is the responsibility of the direct care registered nurse. So why do we need this legislation? Nurses already use the technology to minimize patient needle sticks. It doesn't make sense to have an RN start an IV line, evaluate the line, stop and flush the line, and then have a phlebotomist attach a catheter to the line, draw the blood, and then have the RN flush and restart the line if needed. That's a disruption of the workflow, which pulls the nurse away from other patients who need nursing care when the nurse can just use the device herself. The bill is actually a single source bill sponsored by a company that wants to put the devices in the hands of more hospital personnel for increased sales and profit. These devices should be used by licensed and adequately educated professionals. Patient safety is more important than increased profits. And for all of these reasons, we respectfully request that the board continue to oppose AB 1120. Thank you.
Thank you. Board President Trujillo, there are no other public requests for comment. Would you like me to close this window?
Yes, thank you. So we're going to take a vote. I just want to recap what our positions were just now. So AB 646, we will continue to watch. AB 1604, we will support. AB 1733 also has our support. SB 889, we will watch at this point. And AB 1120, we will continue to oppose. So we can take it to a vote. We have the first and a second from all these different bills. So me, Dolores Trujillo, votes yes on these. Vice President Mary Fagan. Elizabeth Woods,
Woods, yes.
Imelda Seha-Buckowitz,
Yes on all, but I'm going to vote no on SB 889.
okay.
Thank you.
Susan Naranjo, Jovita Dominguez,
Jovita votes yes.
and Trisha Nguyen. All right, motions all carried. Thank you very much. I believe this wraps up our meeting today.
Up our public meeting, Dolores,
Yes.
There has been a request to enter into closed session. Board staff believes that the closed session would take only about 30 minutes. So that is a consideration for you guys today. We will stop the WebEx and there will be no additional items taken into consideration by the board or receive public comment. The only reason that the board would re-enter would be to just adjourn. It is up to you, Dolores, if you want to go into closed session. I know that that is the ask from our staff saying it should only take 30 minutes and I believe there's only one item that needs to be covered.
Board members, thoughts, comments? I don't know if anybody has appointments after this.
I'm good with staying on.
I can stay.
Okay, I'm good with staying on also. So we can complete closed session today and not have to go into it just for that tomorrow.
Perfect. Thank you.
Do we have to log out and log on to something else?
So
Yeah,
there was a Teams link that was sent via email by Yvonne, my assistant executive officer today. That is the link that will be used by board members to access Teams. Please stay logged into this Cisco WebEx. Just mute your device and turn off your video, and that will allow you guys to come back in easily and adjourn. But definitely go to your email. The closed session link is in there for you to go ahead and access. And again, I'll just remind the public here that that we will end our WebEx. There are no other items that will be discussed. You guys can exit and enjoy the rest of your evening. And board members and myself and board council will go into closed session. We will only come back in order to adjourn. Thank you very much.